isang malungil o dosong mera rugul other nilelal seals ilang yung October 9th 2 o'clock satellite office ra Orior yang artiang other Ministry of Health and Human Services kita mo holder tial oversight hearing na-request earlier Minister Wasibos el Mayor Adrablu di kim decide was yung bangula memda ada doon kung tumarugul to sumangali possibilities sa release sa ito. Kung mamuli, kung nasa nga liya kapila agenda mo ba? Makmo mulal introduce sa senator sa artiyang minister. Yung mga ulungan mas kaong mag-introduce sa dilangal may. Mga laklisi ka Presidente na Senator Hucons Paules. Artiyal immediate right na may floor leader Senator Mariur, Gil Marcel far right, Senator Weblao Rudim, Ingal nga Drolela, President ma floor, Senator Nakamura. Ito nga Vice Chair Committee, Senator Tablual, Ungingila, Senator Inabo, Gil Marcel Orenz Abilela, Senator Aldabel, next niya Senator Talams, Gel Radil Ngarseng, Senator Pedro, and Gel Malasta, Senator Sungino. Mga suliril, bawal mga lima committee, mga committee members, yung mga sa representation ng interest, ng Girela Ministra Hel, Mahil Rablo Belam. Utole, yung mas ka minister, minto sa radan, mendoy, gel ko di opening remarks sa kayo, naman.
Ali. Abay malungil talyal sales. Merkawe President ra Senate, Vice President at Chairman ra Committee ra Health, Vice Floor Leader ra Senate, Marbekal Senator sa Rogoy. Malungil sales al mergamiw, elal talyal sales al doorstay. Agi telal segoy agi ngilwat ko elwaseng swala committee ra Senate algog marura oversight ra Ministry ra Health dimle identify gel 4 and 5 topics kura areas ra ministry madirect tial hospital authority algog tangal megok mo masahod mang malungil Masel mo mesak ngil titirar at mamal tirgel guk tigang gestira igagidal urior. Mangarngi gagidal nga raklisi kami adi madang lihat aktor ever. Gagidi at chairman tial aspiral authority. Tial urior mo ngara oratel ra hospital rabelur belaw. Pereng kaya guk mo masahod sa igidal urior. Hindi gel next ringi gagidi director sir matraisaw. Gay dia Director of Public Health Rabelur Belaw makatakatal nga radrual akngilul mele igel tablol issue direct mesomi wato sa ang ari ungil sel to koira aging masel to koira disability ay gay dia urior direct lang ari ungil direct nga ringi gel next ringi nga Everlyn tamangil Gaigidi ako korur taigel tokoira urior behavioral health. Of course ang lara andera public health and then kuk maringisel kuk executive order mlatwa badal wabolo leak laigel lurior bere kadal adirek lamotat ringi vertial hearing rigid. Gel next ringi gerusyang lobangel Everlyn Lurior manguk direkal moringa reporter tirgang maringisel kuk imora area chairman direct kalmle soma bota address ringi sele psychosocial singarang klil atapsi kumesen direct somi ul bota address ringi matirgay gid ya pol mo leader gid ra discussion gid and then tirgal guk ngaraklit tuk Nge Director Arnis Eugene. Ngay gidi ongara hospital administration. Matukoy rarwa hiring mga rangklel. Aldumak ngilul mea. Hindi akal salklo kang gester ngira igel tapigel blada pigel mo masaudre al oversight. Hindi kwarating ilul mail kwarating lesoma mabol. I hope pengaringat temed el selbodom re kay gal issue rigid. El kwarating mo lang seol kuksmao na at tetele lang al sang sila urior el aldangara continuing budget authority. Ang gagid el hera, gagid ya of course ang gagid ya obengel director marasa urior. Hindi again will to irte gagid el BS el executive order president. Ang gaya waku kiblam gora tutkil mo leader sa urior division human services. Oy, baktik mulway sa gid at yagid untig chairman ra kami team kami senators. Tirgal at mama waisem asang raurior. Magulingit talwas sa LCPL igal 5 al issue, igal 5 al topics rigid. Al CPL pa ito kora mo one by one. Matukok to so tangara imol aerials model mo mrek el bornya ger mangir. Ya bol mrek kukpol sa PL maral tirgal at mama kukang gestira yagid lurior. Tirgam asara uririr mang kukta movel mo next al topic adilungil basol. Hindi gel Dr. Mayra Adalbay ngay gidya ngay Dr. Besara kam legiril may guk mom sa dot yal to medical referral hindi el alsil sa ngarnya clinic tir matamasang hindi akal sa el Dr. Mayra Almay hindi ko mamtial lo sigaro lele Dr. Besara kam sa el joiner gid matang magulingit tamal sa el say gidal issue ra medical referral bol last topic about the pick up ngay hopefully mo sa el may in time maktik mulway sa igit emro ko emal mareng asuli urate alal guk mo sa bedal guk may yakuk kasawa tayo luriol kang gester at ko Ministry of Health and Human Services. Thank you Chairman ka Umar Senator Sorokoy.
So lang Minister umasa agenda ka milabi ilway sa igit awul mo ka bunda sa sabal sodi sa medical referral sa yakang gester ay dulo sa tertiary care. Miguel Lugurul, اللي عسى المقرب له بلا مقضيت من المقرب لا الوسبول بلا تقل إذا سبريتري رسن secondary care أيجيل غوك رقت الأذى منيري ونيل سر دي لا سبتو سوديس الهوسبيتال أدوريتي لسيجي هوك مسادر هذا المنين ممغان يستريل الطويرة أو غرول البودو سدمو مسادقو مغاي hindi ngira mo blatak lo sa ngaraul mo demursi. Direct lutoy rayel tablo el provision of constitution en global gula da sa da ye blatak mo radal wasi. Aul mo domi ay gal toy mo implement rayel toy ngaral sa constitution. Ngani emol sa da tora rule ya article 4 el fundamental right am sa da tora held. Hindi also LD yung demukla igal to all mo so separated ya mang loy sige dal suma adra medical referral amameo del may en by the more cell hospital authority Dr. Dever leng ayel baby la ayel mo mes ayel 3 lalo el follow ayel giri tigel vulnerable population ya purpose oversight minister also mga structural issue implementation ay gaya dala detail ang toko kanya problem rin. Hindi mo nakasakal mo na detail kada mo masada detail dada sa tell overall structure. A year will detail a product ay gaya the structure. Hindi mo na so about the clear was ay gala am na separate ay gaya del toy lol tirak ratele ma constitution. Ma hospital authority Dr. Dever mararingi am lang mga leo raptora public health raptora prevention malaki siphon although lolto da prevention so year after year elang damral address raptora prevention makmalilo sa ka malala mga public health MD misulang al mo chair hospital authority makmutial lolwing maskaw madingil sa Sandra Pirantosi Ladra Board what's his name from California? Jason Wells may actually be on hold there all time. legamle request. That's why maumdas that they're probably on hold. Why say why say? So whenever mas microphone, and if they need to talk, they can actually appear. Microphone, he can speak English too.
Chairman, esteemed colleagues, Manuel Suele. Halibok respect the corner. Okay, thank you. Per our PPL 11-16, the Bailao National Authority was established to was tasked with the Ministry of Health and Human Services to oversee and manage the separation of Bailao National Hospital from the Ministry of Health and Human Services. The authority will then be responsible for managing all B&H hospital operations, including hiring a hospital administrator and developing plans for relocation and expansion of services. The purpose of all this is so the residents of Palau can expect reliable, high-quality, secondary, and early tertiary care. So what has the authority been doing? Although our PPL 11-16 instructs the Ministry of Health to provide the authority monthly and annual financial statements that detail operational B&H expenses, the authority petitioned the Asian Development Bank to provide technical assistance to conduct an independent, comprehensive audit of hospital finances and cost centers. This will not only give us a comprehensive snapshot of pre-separation finances of Bailao National Hospital, but will provide recommendations to be incorporated into the transition plan that will ensure that post-separation, day one and beyond are viable and sustainable. The application has been accepted, the consultant selected, and the audit report should be completed by January of 2026. Through the help of the Special Assistant in Health to President Whips Jr., Authority Member Governor Dr. Amais Roberts will be appointed to the board that oversees the relocation of Bailao National Hospital. So this is important that the authority be involved in efforts such as the relocation of Bailao National Hospital. The authority chair traveled to Bakersfield, California, to meet with board member Jason Wells to discuss the hiring of a hospital administrator. The plan is, if possible, to hire the hospital administrator before the separation so that she can be involved in the transition and operational planning of the separation. Number 4, a 5-man Adventist health team headed by board member Jason Wells will come to Palau to assist the board to review key needs at Bailao National Hospital and identify areas of focus to be included in the transition plan. And 5th, very soon we'll start serious negotiations with Ministry of Health and Human Services as to the elements of the separation itself at the hospital. So, Mr. Chairman, I want to thank you for this opportunity, and the Minister of Health who's been very supportive and open to questions.
Thank you, Chairman David. Just so that the members here are aware that you did send the Bailao National Hospital Authority Transition Progress Report, which I had emailed to all the senators. It's dated June 2025. And I will open the floor to any query about the hospital authority, just to say that one of the things that's in the bill is the legislative amendments, which I think should be forwarded or should be looked at and maybe discussed before the full transition. The legislative amendments include the approval of the plan and also the necessary legislative changes and more effectuate the authority. That includes the hospital trust fund, hospital health professional licensure board, medical referral, and where they're going to go, where it's going to be their homes. And so we need those, and that will actually lead to the determination of completion before the official transition. So I just bring that up because I don't want it to be kind of left behind. And then I open the floor to Ibilguer and Hospital Authority. Some lawyer. She wants to know when that, I think Dr. Devon, when does she start? I think you already started.
Yes. Yes.
Yeah.
So even though everyone knows that the law was passed in January of 2022, it took a while for the board to be constituted, and once constituted, we've been trying to move forward. I did get sick for a period of time in Honolulu for about 4 months, so that delayed things. But right now, we're moving forward.
We'll see. The other thing, Minister, that I want to bring up on the law, say the Ministry of Health shall provide those monthly and annual financial statement to the authority so that a budget can be enacted. So I just want to bring those up because that's part of the law, and maybe we should actually be a little bit more upfront rather than after. And then the feasibility study of outside grant funding continuity is what you said. So I think we're fulfilling that. Kaya question gira la hospital authority. Yeah, another structure because once the authority is molder, will identify the administrator, then the structure, the service structure should be decided by them. And that's it, they'll decide upfront. They may adopt the already existing structure, or they may decide that the best structure would be such and such. Understand? Did I? Kamus pa may.
Ali, sulat chairman marungan itasin si Vice President Minister Matoktang man. Alam. A question of the authority in transition as opposed to mga EO 496. Understanding una kami tira no Mr. Bachet no to will stop EO 496 awal blol presidera authority agal lutirak ra sella. Egore pas la budget before al issue la 496 monornya unasung walblol misstep la budget the forecast ma budget allocation wal budget determination tida concern tell authorities and moments rim the structure of legal grant funds am regal nganya risk mo segid system in place legal federal grants la sila hospital velaw. Number 2 say elal nga niya government shutdown, fiscal shutdown na US government nga niya affect nga federal programs sa mila hospital velaw. Lang again nakadanga kan tuning budget authority ida kan swadal borga surprise say because maybe some of your staff are federally funded they kun mo nga issue ra wages are till
Mek kuk ensiraigal sabege kung sa toktang. So, sa igidal blal dalia, Dr. Dever, Chairman ng committee. Akum daswe, Chairman ng Umar Senator sa klol lurior el girel makatmokla sa igid longit tam lamora ADV wasebem support el kutmaklit yal financial audit ra ra ospital lemokte ka wase mema lagat makli sel study audit bodo ngel wase maltelak lungel awdo dal dos perngi lo operated yal hospital rogir madirek sel lungel awdo the sel one se blal take over ngi yal hospital authority maltelak lungel awdo dal dos perngi malodang liya o da authority raw eral take over madirek semo maski daw ngil siyasing kami war senator sa marador olbira kalulaw alwaseng wangra ludaw da also ko mangarnya mo ngal sang sel yang wangra klungel ludaw da los perngi at yal BSL hospital authority mo run at yal hospital on its own now abebir raigel ngiya girel mo makatmokla ay gigidal blamtat se senator Rudy alwaseng el altay meng kagida director public health ng artiyang ngiaklo el federal grant sa mirweb tra public health ra blur belaw yak mo mregen sa el mo utang el mo ed up ay gel blaktung el altay meng klo ludaw tra public health adobal support ra operation ra hospital el alsils basay gid ya aldo may gid el ngora direct el tayga time ti alurior giredal mo matangay ay gid el leng director siya ako kirel direct el mga doon tirigal funders tirigal grantors ay gal federal grants alwase ay gang tiabol separate hospital gid yang sabi ay gid el federal grants al malmol mal support ti al hospital al ubeng diakal sabi masay gid yung maski daw ngil siya sing rawase okay magrabo the replace ay gid el funding ra federal grants el mera hospital may gid ya may bira part ti al ay galurior el ngiamraer el altime makadamo matangali sa igid el moil siya sing mawan sel take over ti al hospital authority yang ungila siya sing el mergami war adro olbira kalulaw wasay okay mlamora imala at igid el authority hindi ti igid daw dal daw spare ngil runner ti al hospital rogir sa igid ya I hope lasa begel wara address sa baby ra issue ra Senator Rudy kung sa doctor dever director madraisaw bol sa biral motel do elay gay.
I thank the Vice President for explaining all that. He saved me a lot of oxygen. So I'm just going to pass it on to the Director.
Malungil Swelbel, Morakamira Kuyel Senator. Haladik respond first till Marcel question nila la federal court status ring nila el al ngariya kuk federal shutdown na pluram rigel. So as of now, I get existing federal grant amalamol al cover services including salaries, equipment, all other approved activities as requested under I get budget. Dirga ka gimesa nga impact ni is el alta meng malamol maurior ma activities samrail. The only thing el alta men yakal sa pamamal access ringi tirigal project officers tirigal federal project officers tatang shutdown when yakal reor and the mlaring at el mil was business as usual with the current funding level that we have. We don't know what's the FY26 budget ng mawangrang. Hindi gal el federal funding akakaroon sa timeline na ringi mga ringi kuk ikelmle mo endra al year mga ringay gel kukulmo ulra tune al year so next year ang malamol malmo tune of next year so different timeline na ringin ding igel way al FY25 al although the remain as is there are restrictions ringin al time PMS mang malmol mal open self payment management system so finance continues to be draw down although the again, the only thing that we were informed of was saying the communicate with our project officers, mandiaka waisel kora administrative support our project officers al-mastery our grantees. Other than that, ang hindi kakangod al-notice al-gimngay, so we still have the funding at FY25.
Well, alam mo, Chairman Rudy Medi, uni organize ra Senator Malayrin na sois, Dr. Bessa ra ko sa ida kami.
Good morning, Mr. Chairman. Sir, follow up, Sir, Director, at sumukwasing FY 2025, ang FY 2025, ang tuning budget, luro bela, wadang FY 20, Amerika. Doon siya man doon from US side,
Oh, I'm from US side. So, I get current funding level that we have now are FY25. Nga rin as I mentioned, ang gagaro sa timeline na rin mga rin araw mo uratun, all the way kuk mo tune na next year, nga rin kuk mula start ra, nga rin mo endra November 30, ombu ulara December 1st, tel kuk mo November 30 ra next year. So in other words, I get already awarded al grant. I get ka impact ring it all time. Unless ang nga rin es el toko el mail wasing mo cut el sel giplom during early March of this year dimle we got the notice el wasing terminated. The as of now ang I get grant el gimolabrel ang have not been impacted.
Sel mo endra November 30, sel nga rin yung dudira adal nga, sel.
Of course, every grant to a salary sirarat.
Sel December 30 mo endra November 30 begin na December 30, siyang pre-appropriated ra FY 2025 o mo.
Right. So nga rin baby ra grant nga rin expanded authority ringi mang for instance sa tagi del endra November 30 lang it's a budget period 1 year. Hindi nga rin expanded authority ringi mang alagi mo spenday kel ludo dela say del one budget period ang sa moving mo next year malamol mo 2027 ay gigi dia very few will grant ang ring say del expanded authority hindi mo still grant on a yearly budget.
I got US federal grants and mola, I got every year kom renew apply mang
Yes.
ang fixed.
Well, ang nga rin nga babil mo phased out, mababil mo ka, for instance, nga rin nga grant, let's say, 5 years at lifetime ringi, and then every year ka apply sell 5 years, sell and the sell 5 year, kukuklamutal compete, also gumtalmutal reopen ringi, so.
Mr. Chairman. Sell mo compete. So that's what happened a few years ago. Some na chance I got requirements of federal programs na mo competition basis, right? Each sector agil apply.
Right. So every public health grant, we go through the competitive process. Linda kadil kita malartel udo ng batok kalat.
North Pacific, South Pacific.
US mainland rogin, my Gulf freely associate, rest of freely associated state to my US territories. So mang sabi edal wasing a federal authority called for a proposal mo fund a 50 grant application and there's more than 50 applicants. So kung through competitive process I submit the application nga review panel at the scoring say pila made it mo ra. So that's the process that we go through.
Whether federal grants under ministry tiket tanga contract ta government tadang separate contract mo tadang tanga contract ta government mo to civil service.
So trigaludo dala federal grant usually to exempt ta status certir hindi nga ring itirgal bebil ludo dala federal grant 0.5 FTE tira grant 0.5 local so that it consider the civil service employee lang nga rin portion or salary tira local. Hindi sugum gudo dala 100% under a federal grant and then nag-exempt.
Understanding ako as a director, tagal federally funded employees sa hospital, tagal subject to the 10% the rate increase.
Sir, kung dasang Maria, dakal salmal, clear maun mong question na wise. Gawin mo blakta ko sa igal federal programs, mostly mura public health. Hindi kalabara hospital. Hindi naman clear sila. Most of us sa city hospital, tayo I got more say. Ay mura public health. Hindi na clarify tila yun.
So yes, Senator Cuarte is absolutely right. Although there are federal grant tagirel support a public health program, the focus ringi a prevention, primary care, health promotion, health protection. We are operating under one ministry as a whole, and that's how we are able to support the services outside of public health. For instance, I'll use salary as an example. We're able to support the salary, let's say, a Dr. Besera, pediatrician, the Dr. Besera, the other server al hospital, direct a clinic, community health center, lomesra arangalaka, ardil lom el mang while split at temel nga hospital, split at temel nga community health center, and that's how we're able to justify a federal grant, pay a portion of salary toktang, because sa habra temel amrula service al sila public health clinic.
Okay, ma'am, so I'll take the question, Mr. Lugoringa, Vice President, Dr. Dever. So cost analysis at status quo. The concern, Chairman, sa kwabi ka selo sa sumumuro study ko Vice President, sa delineation of public health, mulbol kaltukla sa one column of public health. Akpri kanina sing buwan threat ringin mo tagi the disperse ra cost and mora a local authority, clinical public health. As I understand, the kamiwa cost share cost, nganya shared cost. Esel commercial authority marong mamadiak ra public health. The concern, Chairman, so I'll put it on the record, the delineation of the public health, of which the federal grants and more restricted fund just for the public health. And more the ability to disperse the cost and support the local hospital, my community needs. It more the restricting the public health, it's subject to the conditions of the grant. Al time kami generally observe a community. Why
say, but as Senator Cuarte mentioned earlier, amraringi ay grant tagirel serve public health. So in the event ng maral moringa separation, ang maral why say ay public health grant telmle serve hospital, will be pulled le focus ringi amraringi primary care prevention. Let mo separate among syllable separate ang mo tertiary care mang malfocus rato ko raw gurul may kalkwanta mo dahil sa support ringi, but it'll be a benefit for public health and more resources for us as a server cell purpose of public health.
Okay. Ako masulak mo agad sige dun san mo lugoring sa cost analysis di vital NHI. The requirement to say sa loro health insurance. The to the baseline cost of medicine your hospital, I understand the Federal Alberto man mo clear. At tell mo rin authority malara TA, amor to the cost analysis la status quo. Nesel amor to the public health as a separate to the federal, then may abort takadra la gap. Will probably require taxes, malubing additional cost that increase ra. Nil of which ang auto the labor velal na moda kangot source ring. As I understand ng macro federal grant right now ang help ra flow to hospital. Nakna tulong man President, Vice President and the sige the concern mang diswakal stating for the as a sumkomrutal authority nga kabigi ka sige the cost as it yang feasible and affordable. At the end it really doesn't matter say asset service agi the provider in maadrablu. Sige da param na kung sa mo demand adrablu.
Ako Mr. Sella imigul senator sa tiagi del 11-16. Setarayel ngara alsel awasing girel morngia feasibility study mo o check wase gaygidel sabela continuity ray gaygidel federal grants support at yal hospital malubendia kum sengara al sel o ele nga kumdaswa mokte ka address at gaygidel real issue ka wase ay gaygidel do dra federal grants low level support ra bigoseng ng aringa urior al sel hospital madirect imol adal mrula urior al sel hospital mrula urior public health way at aktor besarak malmot bebil man sabi elaw do dra federal grants lom do dringi direct all ko sewara hospital rigid Aigeng tiya igay gidi baby ragir el mora director siya el wase aige talabol separate yal hospital mo sabi el continue el wase mal ubendiak. Oy, igal grants hindi mga betro ko il ditwa badal mo diak sabi el fundang idil operation ra al sel hospital ay gidi agir el mora director share yang gidi ongra la igal federal grants rigid ra public health mangaya mo check el wase sabi el tirgal grantors sabi il malamol mal once al separate yal hospital yang sabi el malamol may gidi el support el mera al sel hospital al ubendiak. Hindi totally magim dal modiak maldo makatam agire dal sika replacement fund ilgire lay gigit
Blatak la kom naswe chair rudim en kadamasada salary but ako sharing ade kal necessary salary. Kami dungura pharmacy, kami dungura laboratory, kami dungura an yearly ancillary supporter al sila ministry. Ay gisabel ko share tel authority map public health, Ministry of Health, separate. Mga riya bibira legal the unnecessary salary, it could actually be mainly the ancillary support. Makumda sa iyo, na body negotiate, definitely more niya gap. That is the whole purpose of separating it. Identify yung gap, that empower public health and to actually do the prevention. Like kita na dito, ngitak lang but we've never really achieved it. So, yes, there will be a price to look at. I think that's understandable po daw mentioning. Kabong Senator Nakamura.
Vice, amamding siya nga kabis makura, manguiway ka nga yakor omdaswe. It seems la segel federal grants el mesois ma atyal selgumi vertyal la ma teda dik statement rangali chairman ng Kamara Health. It seems el mula sa this tyal separation is a long term investment tergid focus sa preventive. Mga skuma federal grants at ang alom sa lo aray kali public health rural kali preventive ko rigid po ang lisel actual cost sa cost hospital etc. Mo blakatakal mula sa altang to kaw do dangal mo na federal malmal nga serigel focus sa preventive health kadar amolu sa bebilel mo na hospital mang tumosikaw do mo cover adi from a layman and perspective other local kamil talk tangan lut at jaluri a preventive health ulgo mabela mo champion na preventive health is that going to save us in the future? Because it seems to me it's a long-term investment the stober kada murugid mo healthy o isa kang agad mo healthy ang modya kada pada atari ka gidel so sa digirigil mo kamil tohtang al kamil murut at talurio ya ang ungil siya ngari nga bulura adal champion of preventive health.
The champion of preventive health is sitting to your left. The way this law, the 1116, was crafted, it talks mostly about the hospital, but it's really about public health. And it's really about separating the finances and making sure that those public health finances go with public health. Now, your question is beyond that, is why are we doing all this and what's the end point? Okay. I don't think any country has basically established that yet. But, 10 years ago or so, a PHOA, the Pacific Island Health Officer Association, declared war on non-communicable diseases, NCDs. And it's very clear that that's the number one cause. Everybody knows this in this audience. I don't need to go on it, but it's the number one cause of death and medical referral off island. Okay. The way to start is with the children. because many adults are just, we hope that they are going to change, but, it's really hard to make adults change. But we have to really address our efforts on school children, okay, and and by extension, their families, okay. So will this work? That's the whole idea of all this effort that's been going on for many decades of identifying what's the number one problem of death, what's the number one problem for us, medical referral. So I think we need to be the champions. I mean, Dr. Corte has been a very eloquent, champion of public health, but we all need to be champions of public health. So we need to convince you that this whole effort is worthwhile.
Okay, so with that said, so I'm assuming the authorities, and one of the things that you're still going to do is to do your SOPs, your business model. So I'm assuming the business model that we're aiming for is to focus on, is to make this, to create this authority, which has already been created, to come up with a business model that emphasizes a little bit more on preventive health, education, etc. And
No.
then, no?
No,
What's the business
The-
model you're referring to?
the business model of the authority is going to improve high quality secondary and tertiary
Care.
health care, hospital care.
Okay.
Yeah, in fact, I don't mean to be flip, but it's got nothing to do with prevention.
I see.
And primary care. That the whole idea is to take the money. Okay, there's no money in hospitals. All right, the only last time it was 911. The U.S. gave out money to hospitals. Maybe other countries can do, but there's no grants for hospitals. All the money is in public health because they realize that that's where the number one problem is. It's not in the hospitals. Most of us think, or people think that it's the hospital that's the problem. It's not the hospital that's the problem. All right. It's really our provision of primary health care and how efficient we are and how successful we are in the community. And
Okay.
Okay.
So let me go back to your letter in June of 2025, your transition report. You state the following immediate next steps to be taken by as determined by MHHS and BNH Authority Board, which is you, so that the board shall establish its business model, processes, policies, and SOPs. Those refer to the hospital,
The hospital.
the actual care, the health care given to individuals.
And that doesn't prevent the public health side from improving their SOPs.
I see. Okay.
Yeah.
Now, I'm asking these questions because I also read Executive Order 496, right? And I've read RPPL 11-16. And so, when this transition is done, can you give us and also the people who's going to be watching and listening to this, what's going to be the hospital setup? Is the setup going to be the same as stated in Executive Order 496? We're going to have certain bureaus all ran by governed by the authority. Can you explain?
Well, we haven't done that yet. Okay, but the SOPs that we have, we hope will better define that whole bit. We're not, just sitting here, I'm not so sure so many bureaus is appropriate for a hospital. Okay, but, that's for the authority to decide and then move forward. And that'll be part of the completion of the certificate of completion process, and the reports that have to be submitted by, actually it'll probably be the authority side, okay, which have to do with the transition and have to do with the operations plan.
I see. Okay, so now that you're the authority is starting with a clean slate,
Pardon?
right? You're starting fresh. You're starting with a clean slate. There's no, ideas, and you're just waiting for the reports, figuring it out which would be the best system.
Okay. So we're going to have the opportunity to really provide high quality secondary and tertiary care. And that's the whole idea. We don't want, the old same old wine in a new bottle. If we get a new hospital, so what good is it if we haven't made the changes that are necessary to provide, improved health, hospital, secondary and tertiary care health in Palau. Okay, so I think that's the thrust of what the authority. So yes, you're correct. This is an incredible opportunity to develop a model that's not only appropriate for Palau, but that will be sustainable within Palau. But I've got to say one thing, there's $2 million in monies, I've been told, providing salaries that's being spent by public health for hospital staff. So that if you draw that out, okay, there's going to be a big gap there. And there's going to be other gaps. And this is why we asked the Asian Development Bank to come in and do a really good audit, okay, with view that, and we'll be sitting down and talking to them, what is going to be the effect of withdrawing all these support, okay, and say, look at day one after separation, okay, what will day one look like?
Okay.
Day one and beyond.
Okay.
Right? So I am sure, all the language, 1116 is very well written. I mean, it's eloquent, okay? But there's a few assumptions in it that I just don't think. And one of those assumptions is, because of the opportunity to provide cost savings, et cetera, the hospital will be able to sustain itself, et cetera. I think that in the beginning, we're going to come to the OEK and say, the ADB said this is how much we're going to need just to stay where we were, okay? And what's the budget now? It's unclear to me exactly what the budget is. About 9 million. Yeah, but I think it's going to. Your colleagues are going to be surprised that we're coming to you to say we need $5 million more a year.
Okay. So I guess to cut to the chase, when is this going to be done?
The report should be done by January.
Which report is that one?
That's the ADB.
The ADB.
Yeah, and that's going to give us a real insight into where we are. Okay, and so I mean, there's several things that are going on, as you say, doing the planning that's necessary, the transition plan, setting up the structure of the hospital post separation, all that. Okay, and then there's the fiscal end of it, side of it. Okay, somehow those are going to have to come together. I don't see us coming together for at least a year. Okay, it's going to take some time.
Okay. Sige, Chairman
Yeah.
Chulong.
Altsukune Chairman and Ungile Senator Nakamura tial mlamo tokol kungoy tial la 11-16 esel wara simple lom sodel awat tiagid yang creator tiagid al hospital o the authority alngia mau run ra tiagid al hospital gid mau run ra hospital esel domes ringi yang mau ringi board al maldiwaya PPUC tira mo hire administrator wal CEO mo niya mo under a board, ito run at hospital separate from the Ministry of Health and Human Services. Ang era, igagida igel preconditions, igagida igel girel happen, raw era sa PL tial separation will take place. Of course, ako damla rulial la al girel, hindi igagida igel girel mo happen, raw era take place tial I'll take over a board. Agot, say plan. Say plan agirel makatmokl, specifically ang layout ramotlet telel operation at tial hospital. Makatmokl say gid. Hindi ka necessarily lol tirak at tial niya accurate setup ra hospital el alsils. Say plan amo other three say gid. Rogir. Self plan. Adiyakal sa el maurior. Alakal mga ngero olbira lulaw ringi. Alakal approve ringi olbira lulaw. O ngerong. Ya obengel say. Makatmokla plan ya obengel ay gaygi la algire dal may ka changes el moral luul belawr el alsils. Leng ay gel necessary amendments el moral la el mo sa el tiagi dal plan el mo taut. Ay gaygi dia mo submit el mer olbira lulaw. Le kami wagiri ul ko ngera plan ako nga gaygi dal bills el nya uldas el molla mo implementer tiagi dal plan. Markoy nga nga gaygi dal toera a budget. A budget mo makatmokl el bol submit nga board. Tiagi dal feasibility stat, tiagi dal financial audit. Tiagi dia cloud to tlel. Le tiagi dia mo o the base ringi ya October tiagi dal budget. Se board mo October ringi. Hindi akal Ministry of Health and Human Services. Tira mo October ringi lang mo base ay gigidal audit, financial audit. Let sa gidal audit tagire law ay sa gidal wasay telak lungela cost al operate at yal hospital. Oy, sa gid. Of course, sa iga kung submit el mer olbira kululaw le kami uyam October daw dal gire law ay gigidal teletayal. Tial la mal di masaw dra tiagi del hospital at tele la separation ringi. And this cell lo sa ringi a doctor dever. Cell was a cell niya end goal gid at talbol roida hospital. Emerkoya public health na sabel mo odolisi ringi. Legal udaw dra federal grants marogoy at nga lotura public health. Egidas misi ay gal community health centers gid. Leng giretan malisi a primary healthcare rabalur belaw. Leng so adal Bible masisi lolding legal dispensary gid malangarat siya regular check-up malungila health tier malakabol ser yal sukum tamas mer unnecessary morning treatment kalbu urtiay gidel klol hospital gid say agora mangwile kada masaw urtiay gidel waset tiang masaw dra hospital hindi sel gora indirect effect niya was ma public health amo stand alone iba adam tolisi ringi mang akmoy gaygid of course ay gel sel one serlia budget board al mergamiu en ay gay amo address ay gel among sang sel awdo al bolo spe ti ay gel hospital ma authority gukran at al hospital.
Oh, vamos.
Melal way say gid bilkul akmo lasing akmo legal bureau kami adital bureau of hospital services say gid ado dang lil malmo engel tiay gid al mongel authority
Why say let's say gid ya say at al hospital.
te hospital
Say.
and then ko legal baby la bureau kum amo di say da ngara ngaramong mga radiak.
Well, sel public health Bureau of Public Health niya makatatal lo ngara laygar roguy lurior public health lo limo klarwa aging ma disability ma behavioral health say makatatal way say hindi multo irtay gidal BSL executive order president del dirgablel sign ringira September yung wabla lutel separate ay gay
O kumisig naming mo
tal mutel BSL bureau hindi gay ay gay malamol mal part of public health hindi akabol part of tial ministerial hospital git.
Okay. Hindi kayo sulang chair.
Oya, ulit sa inabahalik clarify titul to umsa da mamlen correct. Ongerong tiagid. Ngiyan mablatak lo settle authority under office of president. Hindi akal separate lo PPUC ma PNCC. le Article 6 akmul wasay aralaw rule ang alela amt el free or subsidized. Mali, seguida ang Article 6. Ongerung, marwang tial public health, as we know it, tiya mo Ministry of Health and Human Services. Iniktali seguida ang bulbakta. Le hospital adi tuwa, tial rest tiya mo Ministry of Health and Human Services. Senator Inabo.
Kamedik giregal sel with all due respect chairman ng committee sel ngiya mo authority mo runner ti al hospital se stand alone that's on its own tiya mo dictator will toy ratoy hospital, so we know that tiya nga mo board of runner ti al hospital yung nga administrator al CEO. So, hindi operate alwaya PPUC. But we know, was by constitution, that raw rule agirel free or subsidized. Preventive health is totally free. So, ay gaya constitutional provisions, al girel mo tirakla. Mang ospitara mo run, tiyagil authority mo runner ngi, but we have to find the way wasang makaratol tirak layagil provisions sa Constitution.
Malungilitasil si Minister Toktang Dr. Besara kamsulang almlami mapto question ramam lakorkaw. Marukwil lawlera hospital kumal masawlera mring lureliw. Minister Kamal masawlal mla smoditel hospital authorities el separation arngi. Ngaringawan al kura ongoing issue el all time kumdas lwaseng ngula kal mortal separation namang lagi dal kal mong isuwi ay gel bills ra adal mo newing ra hospital taying el asil baby lang ati kal sel taying hindi kal nga bill ngir el alsils sel taying alsils sample ol kora amde like al bill tir di madela masel baby la INHI at kal reimburse ra hospital. Sige daw ulang close accounts receivable or hospital. Diri kal taramle assumptions or siral lo mayo tel bila olbira kalulaw. Awasit tel hospital authority gukmo BSL institution. Amo sa el bill ramral amount ra Acostra services, el hospital provider ngin morasmer, el collector ngira a National Health Insurance. Mang ay agi omdas el direkal wasya mo part ra at el cost analysis ma amo o separation ra cost agirel include el wasay makarang at funder tel hospital logi wa INHI gid el goal gid adire kalwasi kada mo o provide high quality secondary and tertiary care el mora other below ya hospital gid mo benefit from the National Health Insurance Program gid am creator ni instead ra di oldurok like aludude del mora outsider belaw ya kada mga nga hospital kita dire kal mo sapel benefit from that mga malumrang almaseng say kita dire kal malgirel mo integral part or tel separation ra tel authority mo orut tra hospital gire dal mo sap edal lor kadiyak klora gude dal ngartel belaw mangmo sap edal provide ang will service sa mga other bilaw. Ako di tigal complain minister ilangan ding batol other bilal mo smere mo kurura krill bilaw atigal they don't feel was they're treated very nicely. Maybe as kung hospital kita gets to that level and we will benefit more from the insurance system that we have. Sulang. Sige na kami tara.
So lang Senator Inabo. Ang nasa will korawul das wase ngwa dulu se the creator 5 ng ulo executive branch. Di why private hospital run by a board ng area. That's the whole mentality. By the mobile dingile minister the mobile mora medical reference sinseng ngoraway al bring up niya. Tigele bebira hakali sirang tangara line. Are they on the line? On the algo tom na mga motivos. Madalmal Marcel medical referral. Kung nasa nga niya mal tol kami tra adal girela sel el medical referral. Sa kote sel RPPL 10-31 siyam na separate committee ma healthcare fund. Ya ongerung sel 11-17 siyam na mandate healthcare fund ma medical referral committee rula every 2 years at rula audit. Ya merong 11-20 sel RPPL 11-20 na require medical referral every 2 years and giri ruli audit. Ongerung girel nga niya igagi the report ul mga ulam da sa siwila adul girel ay Agaria requirement rin niya sel sumaya report tadi alme we're actually ill informed. Tiyan nga se del liga once as often as deemed appropriate no less than once every 2 years. NHI financing governing committee ma medical referral system magiging mo audited. Lulta rin niya other medical referral ma healthcare fund, malubet sige external audit. So just to know for record was al time audit has been asked by public auditor. Ilmomruringi. Because hindi na katala audit rin na ako talbol la 2022 ilan 2025. Makti ngun marsegi diling ngariya reptol senator sumlamong haledi ko ay si Dr. Besara. Silgo to close complaint ng Lawrence Senyar daw say chingwa mal di overstep percent roller ni ngar say mga dedra sa arirars mer mandi nisal duli say gide clutel di o igalo sa minister ngarisel el igagide le ale MOU will sign the sera 2022. Shall go the line as a beginning on the effective date of this MOU. All island medical services under a healthcare fund. Does that include patient care, Dr. Besara? Medical referral say legal information is strictly confidential. Sel MOU seladul say of island medical services include patient care, patient communication, recorder tier.
Alingil Odo-Osong, yang ngartial Vice Chairman ngartial Medical Referral Committee, nakal MRP. Ya opang ka Dr. Deborah, Director Member, Ya chairman ra kama Dr. Myra Adalbay. Dili ka maral may halbo ko tral mo answer sel question ra kawe Dr. Dever. El akama abila Dr. Cuarte kome. El asegi del MOU el bel al simple MOU 20 sel sa nangira 2022 semlo separator walbol separator tel MRP makamamel MRC so kamama nga kangartial medical referral committee mal roller kamama mal di mo agi senkyo every month sel nga ngasme vote based on the medical needs rasme direct advice ak masengaral hospital raw ngi laboringi based on our experience with the patient conditions Ingge lobang kamamal ko secretary a house tra hospital under a hospital el asel book po do sa MRP ay kay segi del MOU lo separate ra may kay rogur el ang yung healthcare fund you're talking about sel gibo miracle senkyo sel seal of paper LOI sak masetter wat ang amli accepted ngarang urgent cases amura healthcare fund tira mo star se trigger sel lurior el girel sendrang kalsme el mora kurura outside so malak quotation polar space nga gel requirements el may masada ko payments travels medical family escort travel el more sema accommodations el mora sel balula boringi alis ko matamong LOA matasender ng ilmong ay gero gulu larang gelsmera ade akan ngari akan gester kam lagi mala medical summaries on regular basis this ay gero gulu ng gelsmera atirigay gidel ko ngarsia o ngara ala so Taiwan en polama achingwa ya huriping en tati tirga being paid under healthcare fund before yung legi segi da tirga kada separate el antira healthcare fund ong artim tirga ya
Hale di clarify.
communicate
Tele MOU as all island medical services staff bank accounts related records from the Republic of Palau mo transfer mo nga okay akmal di one question medical services se lugru nga sendra smele ko medical referral committee kung approve niya mara guru se lugru tam southern tedire kom dire kom la gilingem tam southern ni medical healthcare fund tam southern guru alu tukuk tim southern kredim me agri lo se marur taigal blai mara ga di tel guru la ta urur ta guru tesel guyuni leng to behave as if entir ongra guru makugel ka gumilo say Komle agree was all island medical services and that includes atingan toktang el margamiu el mortirgeng tige adir mongurar sel torak awagrulo aluba tukte ora ikal tora administration lel sumto ora to gurul enda tila de malmal tila de malmal ndal giring ara laing mula sendal giren selong ngil mulwa say tial MOU akiren mo consistent Lobang gila rogul existing ala. Misal RPPL 10-7. Dahil relegate lang alela Ministry of Health malbeng kang committee mul ministry ang idila. Clarify sa iyo because nahali akal ko mulut kurara. Ngari other may tadi malmal ngara healthcare fund call more when they shouldn't be. Mga din mo tulog yun kasi kililungin po domestic yang EWT because I don't think ngarias meron so lang hotel ata polo tinge rektel still lumano sa tokta yiril masa araktirar sper hindi kal yiril adraw do minister makadi duli seblel sanengia former minister kafar minister udoy maulay tulum le SS administration approved by chairman Dr. Yano Makulit el wase kale lungil podomer sa seguir tial tora guru remain al ngara imorir medical profession sa kalbora imorir ang modala.
Medik aktirege senatorial mla gora ngarnyar direkal adrablul lamla maraw gurule may e direkal raise ra osi civil issue waseng gay gidale gerdir Tsinghua dirige orior tiale HCF dirige ang sel ngakakukngak et tiale HCF ang arngil mokte arngi say funda take care sel responsible sel part ra funda yung audo girela yung will referral to the blur belaw maal sila blur belaw direct ding complaint el black rang siya direct waseng gigidr dila waya baal lobas ay gidel kuk dru lel esa employer HCF ewal warar murtel masada waseng sabela patient moray gidel service mal ubendiak leng ese nga ka direct gongel way gawal wasesel ang ra al lirar adra referral committee tigil ospital mang akpay makatatalom das suringi chairman was yagi da kalebay solution al asol partial issue kita kalebay do spera agora patient referral coordinator alngia ngok ngarasay dar patient saldol durok kortir el moraygal guru ray krel belaw bay gora agok make sure at treatment mora igel medical treatment mortigal patient tamaral receive marokoy instead ra gukti i-concentrate ra wase cost ringing wangrang luway ngay gidal singwal urior el ang mora HCF petirga kada understand ra roller tirga o siga rolele minimize a cost ra at ko ra gurura ay kal ay krel belaw sa igidia
Dam sulang Minister Akti Sokaldulin was ang RCG dalang was no person who's not a member of the medical referral committee except the treating physician or their designate can influence the committee with regards to the patient. Ang yarong was no person shall disclose any patient information. Mga alirar you are adi was it together benefit tegi milung cover the marko. Hindi kalgiril mo decide kasi kam na mo terminal so therefore na mo gire mal mura blur belo. So that's not their role. Makulitul was elal lang artya. Ebo mesa sel MOU clarifying. Nas in the long run kasi ko mamre ra medical program. Hindi for the time being mesa sel MOU the triggering was hindi tegi mo koringi the implementing. Moringin gel imala guru ngarsel masada rakteras me. Siya kung nasa ngiya del morning. Kaya open na ulan more cell discussion na medical referral.
Minister ka malungil isa silsila ko mga doktor deber mga doktor besara ka material. Minister ka mulamurat tayo mga agreement mal madang litel toy mo. Sige dal ko rin MOU ko kung tisil MOU change rin mo sige dal aleleng sabihin lang atito ko lang
President Senate kamama orior executive branch mang agok druulela executive branch loya ka President Rebelaw yang was memolomol matialurior medical referral program el ngari ungela HCF masay masel dulway siya marredar executive branch yang akal Minister Health agire lol taw tringi ultirak ringi so
understand ng yang kada mo so isbra ko mo problem ra ko hindi ka di kulo ko rin yung dimlak lo ay sira lel el molmu tersegid ral mrula MOU segid ang start the problem el mere lang which is in the other ikati ka doli kada Mr. Neil and we are facing it now mo kada mo lo watse ang ngari ro lel that change ni kada gi kamam kada gi tangi en lasbe del kay share ni then sel HCF al agirel guktul to daw haram ko. Ako may aksay akum da siyang lemok te ganun. Hindi mo nakaligiran mo manay sa ikal outside the hospital. Manay sa Huriping, manay sa Taiwan, manay sa Hawaii. Tamla mo mrulay gel di kalgirir. Egi eblak taklo ay siya mang akti ngul lawyer aw lole de kayong silo sim kadam kray sumaklil mo de kalo ay sire lang lang. Alang da sumaklil lang kadam mo ay siya mang problem makamplain ma ara ada lawyer ada ka rulay gel maral ngrali.
Kiyal to ko era o referral program at yamal makatratal issue, it goes way back. Maningil terdir kator olbir ra lulaw president ra senate teng direct kalmlar niya issue tirgel guk lulu ngara ra yal lurior ngaray gel belu mangle tokol time al dosaw dringi el at yagid I guess amle hop pa wase game guk terlil mo it yagid since HCF ora ala to ko raw do maruguil take care expense ra ikrel belaw ma al sel belaw ekale dong utial ureor ngul mastri ekale ngarnya ko improvement tel morngi bang akbal understand ra kuk ay gidal guk lamet wo badre lam egida so adalo si grabester ra el musabel take care kodomes ra arala to ra guru at the same time kodomes sel niya mungir tirgal patients sa other belaw the refer tilabor ikrel belaw babay sa gidal solution chairman ra committee ok mong langar niya bay direkal bay guk era ospital malubeng referral committee lingiya wal ngaray gel hospital guk kwara help vertical patient sa malakal sal guk malgora di o mesersel wase kostringi wangarang
Ja, om dat ze minister ng Malblaw taklo. Nandi sa yidel one al World Medical Service redefine ringi. Di dong usel tel guru tokora guru malol holder niya ministry hel ba medical referral committee. Kung ulam sa vice chair Will Elbora senator on the bed.
So, Chairman, ote Vice President ako nga sila mga Dr. Deber, mga Dr. Besra Malpekla, malimorte ay hilto ko referral. Sel kudulir adam lamong emay ada obrada wula labong esel meya mondelingira diakal mondelingira gurul mondelingira trigagidel al trigagidel lon ngasiw itam lamo blobel may tabay dim lakal ugera mondar tel hospital tamle ugera mondar kal adal domdo dringil lon ngasiw gider sei makwade melulu kalau saya skum palasir gemiu maknitrar af magaram sa makliya palasir gemiu bolongirar ada los pe angeso seguida untig le korgal lasem kabo mesalo se komgarar uli tial tretelela ada lograda rakte ngar belau mo menga udo en masas kokil mo yalger den ugera mondai dial selbak Egan sang saudu del. Ada mga do ringi. Adi ngar madalek muka di garolin. Hopeless. Ngaral berada mur trigala. El baby lagi. Sige damalon tigil ngorol sa kabo mesatya. Lel sukum ko oklel mutul tarakal. Ngagil do sisul ad harar niya ongar mel magid. Yung kura mo tegi sa gid harar adal mo. Berselo makal mergid, teman ngasih urgid. Segi tadi, just an approach. Aktif ni terasa, kamu kalau muda albarinya semsi klolele dan sutrir atau malbu.
Sulong, ne kuya sa senator on the bed.
So, la chairman nilitasil se vice president ko to dever matigal adra ministry mdila kalme. Katangar tiyagi del tokora referral vice president taktiregal kora mamalgal al adra la direk al mla adra olbil maga direk al madinak masesel la tobda la al kut maklia structure program
Amoktera program yung adakal sa edel de MOU etc. Mukha po mo mesesel MOU na seseng niya standing aril sabel wal lengarak katyal mandate katyal 10-7 le 10-7 namle created namle established at medical referral program yung ngaral ngun sa ministry mangirel ngaral na ministry akari mention sending waigel blado tirgal beber senator still concern na sa domestic ng ultimately ulmang milkat mo kultegi ng medical referral program awal armor Ministry of Health al selbolakal sabiul deliver raigel necessary lugurul mar patient kada more say el process mo refer til mo outside mo umalay gigi lugurul man technically medical referral program awal armor Ministry of Health lo mo provide sa gid service di kasi edel provide ngira sa hospital maulmang necessary domestic ruli mang malmol mal partra hospital services ablur belaw egid tial amat mo kortial SL hospital authority metiang basically domestic mo partra and hopefully sil makatmok taygi del hospital authority able sab al elevate taygi del rokul al nidra ugurura al belaw spell mo sab del di deliver al serbela malakada modo minimize taygi del mo refer adal mar aul mang mal noklor problem ra before ar adaro ko selbol se et soril access ay gelungi lugurul soril direct access ay gel ngesura kabalmental mo walang sortira to gururtir maul makada mlo kora amlo problem na before limited funding el mortegi del medical referral program mangkata mlo force created tegi del gamitil wal ball screen ar adal tinamo require a medical service referral services maligel di ka sabi edel gutmok sa bela mang agira del sendra adel mang agigida akora gidel mo malakkel wal basis at tagi medical referral program alan el mo agigida guk plan gidel no atmok al gukmok created tagi el hospital authority mo sab ela hopefully tagi del el authority ma oriolo bangela tagi del existing el process medical referral program able sa bedel galek tagi del rokul information el mo sa el go maskida agailan ma tagi del authority bol sa el go komes ay area of services ma gurul namo sa bedel invest taw de da blue belaw man sa edel di utmok ra sa bela la kaditi differ adel el mora Taiwan ma huriping leng diregal dome sa ay gal lour amount tawdo the send del mora medical services outside and di maral elal time ang angal ewal milyon na bekker ka ada spender mang sira taligarat celebration tali national day Taiwan nga gigura amnom na lautat sa tegil to medical services sa Taiwan ambassador ako amle quickly assessra al disira selil disira patient blast till more al stat tegil referral ma singong alin din singong along en meron nga 120 million al estimate blada spend el dimora augurura ayegida direct sa edal malmera da suede bolsa bedel integrate mo part ay planning argid ang kumat maklet al hospital argid leng cloud to telela adolas mal manggegarer sa igid el teal oldura kra adan ma gurura outside by dolisi at to gurura al selbelaw at igid el hospital authority kumrak na sen sa bel bol liliak level focus til girela to gurula kumdas mo sa bel deliver sa igid el level gurula mo oswela adres tirigal sincero to leta singim lo de katel actor de ber aldasen direk lungila Camille Adrabor, Bol sa PL direct make sure ko mo part at tiya process ra selection ro hospital. Sel mo select mo hospital ng murger, masel design ro hospital. La kami amo spare tiya del hospital kami amo route tiya hospital matya rogil structure hospital abam mo route ri mungil gamiwa mo part sa del al design designation nak masing ngaramo ungil ideal location for the hospital. Siya kumna sen direct ungil al dimension ring mal part ra tiya al transition plan el mokling. Ayire chairman ang katiso kal selling tiyan ligar na tokra medical referral programa nameseling maral mla akora explode ma point lakad maria del other sergi en other patients mo demand at klase kama magira man di mo na medical referral en mo kato tiria cost ringi services kita mo oite kita adi mo focus ay kita lorduro patients el mara outside bela sula
may medic pagkatakli imulto ko cell 10-7 segit cell la niya create medical referral committee insakal makatakli tiyal mergid bekla create medical referral committee esma daw rerel mga alel hindi ako sa medical referral program alay katablol kakarong saltokoy nga kamla asigar alla المساعدة medical referral program and yakala al total specifically yung address ra medical referral program. Okay, menso ka bol blakatakl selling kadamol wasya presidenta dia ka klisiel ngutial ngunsa nga HCF el programa mang runner nga HCF no okma nga nga la specifically yung wasay tial medical referral program agirel di nga al sila Ministry of Health and Human Services yakongelo bang gamiw okay then di akal sabi edal mo tomaliala di again di akal la rablur belaur el al sils specifically yung wasay medical referral program agirel nga under Ministry of Health and Human Services say yam sa TLL tial a president manggel guk mle minister ngir sel time rule MOU lo manggela HCF o manggela SS o manggela finance elwase melngutial ngara alngul guk transfer ngi alngum sanga HCF esin se torur tawdaw tirgayidi o maara rogwil toera guru right krel belaw level beot tigil process say a reasoning behind the say gidel le mubringil mora HCF now akmal understand ragel concern ra Senator Cuarte ma President ra Senate kityal nakamaktirigal lang may osisyon complaint ra adrablo tirgal mla mora guru melagi da pa yosi ra solution was makarata addresser sa higit rulil maungir gaygid al patient al doldurok ringil mong malboen sa el guk ngaringi ang arselo urior alwal guk kalmadalang gaygid al patient ang arsem guk tiakadil ilgora di yung makpitang al di yung guk ti ngarasay ra HCF alwasang makaramang gegrey kal cost marogui sa higit yabay gire da remort del hindi as far as tiyang mora tiyang ungil ngara imal na HCF malubeng ngara Ministry of Health and Human Services again hindi akala al stobra at taraygay malapen hindi so al makatakli sa higit magita ba yosigira maklung yolel
Buwan malbutak ko. Ako mdaswen dahil issue ra medical referral program al time le hospital authority mo decide wasing kung mo rusel enabling legislation lo batyang bilmorgir. Issue ra ala medical referral say hindi sel tele rule adim nakalgiri siya nga imal na medical referral committee ndim nakalgiri let komsyatial message lo say all medical services adi kalgirel includer say gidi aong erong sel MOU say any and all liability arising under this MOU shall be the sole responsibility of the medical referral committee. Yeah, healthcare fund na dia. Maktiyo wa sila say Imamia de kalngaringi, hindi kami liable for any and all responsibility.
Kamal masawlo sel kamen te kamama kami timla amlo mak tiang amal direct mal klol complain arsme elmay raw eral me minister oilo mang tia direct kalmar maral langalamar adra medical referral kami rile kamama we're sitting there advocate for patients mang maral masawla minister leng agimla mga dadu erngil girel esegi del so there's two things. Seral separate the tial, sera gibom separate, and kora mlesom legal responsibilities ra billing mrula ticket mang maral kora sera gim separate ang maral mlongil. Dim nagim real ang later on nagi realize as you know there's really nobody there to fight for our patients. Leng tiragal ngarcel UR are being paid by healthcare fund mangkamamada kal okmong agi harartir eng ngwa before el kibo se mokorang ngari nga SLLOA ngari nga SRaktel agi murtringi el asegi dagi gora mokoto ma angara mringi mangiba imla mga dura minister segi del we decided that maseng it's about ngire del fixer tiar el al ngire morngi patient care coordinator el ngara itself site lingkang kal sme ral mora healthcare fund matoktangan ngir bela ma medical referral le before SL kimsendra sme el mo let's say heart attack SL LOA la letter of authorization maldi mom saudra ikel kiblem agree di suko mangmong ngari nga chance ya before double all message ra caller chairman yagi quickly make agi vote si okay approve tial BSL LOA segi da ko ramle practice rang ramole segi da ngaralang gida quarter man mo makataklis tedi tirgegi dal 5 al boarding member el toktang license belaw may ga decision al refer or not ida ka adal mo malmasim resel decision lang obal sara 3,000 ng 5,000 el aseya kora gigoramle overlook teringi aki katokora di mlor el telamu be and then ang morning kay gidel madudumel you know asme ramong engar yang raktel and we didn't know and they didn't approve ya later ko tukromeng sa set you know tamrula fundraising mga rangit martok tang artirame ogera kamamel you know kamamel adra medical referral hindi kang gel adal you know ay gel ko present tel cases ako you know ako kremeng sa adrara el kung tamrula fundraising igay gidel hindi sembral nga rala dia ka you know so mga nga chance tial condition na adal nga Taiwan eng gidel kama mamom dange approve dia kal may kay kita you know agi ka adu el girel etral mruringil malmo leses edel mo tautrala ringi di segi del patient care coordinator amal segi dal amo sol or tiagit bre dal say I think ang acute
Minister mak-suggest sele mo you dim define sel medical services model included tiagit ongerung era pasma microphone di so alaway sel was tarayel strategy ra medical referral committee وتترير سبيشاليست المربلا من سيد السيبة ودود قلت الإيشو سؤال بين أبنية يقال البيبر ورك هرمي قيدا هذا نوفمبر أكتوبر لاستير ناقيد الدرجة البيتي غابا بيلينجل لتيجي كلول confusion happen ناقيد الدرجة المرملة return نامك ميدل 6 months ang yung Dr. Besrak Dr. Dever Tirgal specialist may trial saver gida udude. Mga ulga refer as mga gaida emails may 3 times sila sa other user canvas pa kam tigir work may gagida raktel. Maksen ringil mo tigil nga tayo ang mail other use. Ekmul wasi gagida raktel ang kakad makarasol para problem ringi. Ang wasi pas LUC underline wasi ang ataray gagida kulula riyo match mandi ka momsak. Inya LUC prescription li gagida ataray ng momsak. Hindi ako tubra nga. Hindi ko matelal kung ano doon at medical referral was even cataracts. Aklo siya igal mas ang kakatarak to amda sa tamatki tiralusil mo tumena kasi ang kakatarak mengire lobot ko. Mas mera amoy tawdudel mayaro akmal o lingit. Iti strategy sa ibaw do. Tirigel specialist na may at sumar other bela mamoy tawdudel mamesertir. Please let them be in a position to solve a problem. At suntok timel memsu clarify rin malaka the reference meron mo. Please akmal o lingit. Hindi ako sa minister. I can give you a start. Makmalo ito sa laboratory screening, daw sa medical referral committee, alam yung director of clinical services, ang tanggil may gara decision sa tigil specialist tamer belaw. Di ako tanga, lumayan ay doctor nila July, alora hindi mla ka follow up or other lulmot kamdari. So some of them namostatin maralmi, ngariya problem berti. Masin reputation ra I care trial developer here after rada siyabal almi mar adra Israel el malnorbab is tarnishing now. Makulit lo si mem screen trigger specialist. Nabas hindi akal fair. El mortas mer el mga tawdo dire el lepsat yalo si siul kada gagilong marabli lengu en taram lo ramor ling kada lo mula kal atta ngati kita pabingal ko makmalolingit minister men belilo sa makarang maybe medical referral as el screen trigegi del specialist del may malmaral help brigade
Kamso lang
ale labo ngaya samloy
Di akti mreng asule mertilang magi akul mo mas tirigal guk tirigal gora arrange sa kay gital tirigal specialist del may el direct kal gora mo consider ngi
Suno.
waset tamaral tok tanga guk sa betal ngo iti trail mail maral sa bil ut makal tirira twitra other belaw.
para senator inawe para talam sir after
Ako mingi, Minister, kalmutan mo ra a medical referral. Minister, ang maral, ngagital mo o coordinator, patient care coordinator, alasap elol nga sew. Amle, tara, gibtigaringil concern, asil tayo nga patient, tende kalunguwa, abilaringil ospital. Aigel medical records ringi, maigel treatment nilay, maroku ringi, mabilar ringi. Awel gora, adi kalborang al patient. El adiri kalbora medical referral committee, de kalbora a chart ringi hospital. Magumda se segida malgirel mo, o tara parte tagidal palasil wasay girel arogul record ang kal patient, talmera medical referral committee, leng medical referral committee kaya authorize ra ngidil medical services sa ilang al patient talngo. On top of that, adiri kalbol sa ilang nga review process ra medical referral committee, I'll make sure agel ngila patient, al care maselbi larngi, amral maral ngila yung kal patient, emlar nga swirel morngi. That way, nga niya ko ra check and balance sergidra National Health Insurance. Algo kolpor nga mistake mal ubeng rang kleling sa pedal mesang. Ada dire kal mom dangel wasing ay kaludo dal doldurok kal mora adal mo gurul, mal ngaral gurul, mal ngaral el service al ngilu ngara mal mring la aral le etarangar la medical referral committee awase which of island the provider will provide the service ngirela MRC decider say mang girela MRC ngari gagi the recorder ngi mang sab el megra well informed decision ak bring that up leng tangan nga patient al me wa ko te ka recorder tir kurate kal sure basing ngara next step tamlamo matamlame karangal continue ra Mangariam lamong may continued patient say manggiril flyer every telal builal mongol which is ang malmaring rangkal patient. Ang mal say the patient care maral those pairing akti duli say the concern mang mo sa piul kora arulik tel patient care maral mo provide the information sa pedal audit ra insurance sa pedal audit ra care providers al mergid may gel cost associated with it al malwasing reasonable al mertel regal utude tam lam oy tegal patient targi tel 120 million al plel mentioner niya estimate close to lang we're spending telang 6-8 million a year of island medical is a lot of money mangira tal mal make sure the value or sell dong amaral ruli dal mo healthy mo tiakata sir sulang minister
Dilungil edik agum tabe chairman kita alangaringi awngil kadal ako ngel rogoy wase okmoy gigidal wal waramo patient referral coordinator amoringi ang lamal klawal help ringil address tial do sa ringil problem tigay gidal mong akti kamba mamal ready president ra senate el hire ar adal moray gay agi sukum hindi kada sum kada activity el waisay agi olingit ta ko ra se seraw do del mosabe el helper tir the pair tir en malklawal sol bringi akong tak ongerung sel dilia senator chairman ra kami tirawalel ara adra HCF tadimlo matangel wasang aringi tiyagidal hearing arigidal al sales direct wase di mo mawai sa senator sa wasang aringi RFP al bulol to badringi al girel segid al medical audit al girel a medical referral program ma medical referral committee ay gigid ay gel sel audit medical audit se tirigid al mo to badringi ese segid sel olgoring wasang every 2 years ang girel ngaringi ese mokte ngaringi tamo Ustadil was igel niya criteria sa lultoy la medical referral committee may ka decision al refer adol to but tirabalur belaw moraw gurul malubendia kay get commit tol tirak la direct ngaringi igel was igel services niya igeng fall within igel parameters la set tiagel referral committee tol tirak la igay malmo tel bebil tial make sense adol durok kara tirgal patient tamlamong oy ay gigi dia baby raurior el bolong at mokl sa igid el sel top da RFP engel mongu sa igid el bit amugut mokla igid agumdas we senator Inabo en sabel address ay gigi el baby ragumising issue blam raise el mal maklaul to talel adi ngaringi direk blel guk printer ngiar adra obisir kamam ilwasen sabi ul share ngi lobang gamiwar senator Israel DC la ger roguil cases am lamer madala medical referral committee may gel rak tel tiram le involve ringi may gel guk gel blel approve may gel guk blel deny may gel direk gimolap mong sabi ul share lobang gamiwal so kamiwe kada gimas kamiw mo guk ti partra recorder kamiwe
Sula minister awak mayum sa senator Telams sa yidal RPPL sel tendas 7 ang sel partner sa medical referral committee shall provide an annual report to the President of the Republic and presiding officers of the Olbi Rakalulaw and the Minister of Health which contains ay lagi the information so already ngalala diratal lamrun ti kwadi o ay Senator Talam sa ulali ko.
Sila Chairman Kwate, paluwal tulad siya sa Vice President, Chairman Diber. Kung ko am na-start implement sa RPPL 10-16, yung ako sa report na medical referral program siya go tulo mula. Tara 1996 and mura 2010. Lo eral bonia sele healthcare fund. Nek middle 14 years, medical referral program am nesendra ngara 900 patient. El mo off island. Umusin de tiram nara a Philippines em ne spend ngara 13.5 million. Ay gegen ne appropriation logiwa ulbirang lulaw. Ese alborgia healthcare fund ra 2011 and mera 2024 ya medical referral committee amla approve ang ra 2,600 per patient. Amla spend ang ra 33 million. Lulimo ko ra airfare. Akpal oil nga niya radon na malgor nga recently a few weeks na memo na niya ang adgar belaw na ramrigele mer belaw kirel malara adrablil mura gurura a Taiwan el medical referral committee agil ngi dimil ngi mol modal sabel ngul mura Taiwan manglo en abel ngul mura blu ramrigel el mura gurura ela agume setial lidisirar adablal approve ni rakmer nga 13 years persis sel nga 900 Ingaria 16,000 el other belaw nga healthcare insurance. Ngaria ko ra criteria ra medical referral committee lo spe emergo decided mut nga mora a medical referral a kre belaw. Malubi ngaria te lulo mesa set lungila udo del el nga healthcare fund de uldrokra ad mora kre belaw. Leto betogel ada approval tik mut mora ugrul. Dit di mingil el mon model sabrin mora ugrul. Makora olngit tut na segamiung komodo dura healthcare fund il kirela patient me approval tire mora ugrul. Makom dek na singwang raklu ngila udo del el mo spe el sendra.
Medic porcel tenda 7 agumda so sayid ya makatakli ngaralel tayo del committee se ngaringi tirigel 5 al medical doctors al practicing medical doctors rabalur belaw tirigay tirigel di team al may decision rawaset ngara tirigel mora referral mga radiak di before they do at ngarala adiregal required was a alia sel healthcare fund agirel certified was ang aring availability ra funding aldom tangaring itirgel ex officio members or sa igidal committee ngaring minister ra health ngaring minister ra finance ngaring a representative ra HCF healthcare fund tila igid ya mokte ngaring hindi akal may decision ra referral hindi ta direct giril low ice ra tirga igidal team toktang was ngaring ya kita a decision the may garingi ngaring udo del available central rat say git hindi kel quite kogeragel criteria sa base sa referral committee may decision yes alla mal makatakli tilang sel ni attendas 7 sel over sel section 333 D Esay kita igel was a referral committee girel make a referral decisions based on the following. Agot, ang patient's ability to pay for the cost of medical referral. Okay? Sel ngal patient ability ringi el pertial cost ra medical referral. Ongerung the patient's life expectancy. Aklangar ngal aral made elong wangrang. Ndir ga gamangat talubeng kakardioduruk lilmong yung madrak lukuk alubang ay gisaygin. Ongede, the patient with a condition that can be treated adequately in Palau may not be granted medical referral benefits. Mang balgula wasel, suko manggal patient tasap el dingar belaw e mukar en dia kadol durok kuringil moray krel belaw. Selong ewang, the likelihood that the patient's conditions will be substantially improved. Kloate al Arnya ungil teal lenga the refer ngil moray krel belaw el nga treatment teng maungil leng akok the other way wase akok ti dol durok ringil mong matengel waseng kadiakal sa el maungil ti dol durok ringil mong say yatra factor el girela akamit tilomes ringi eselongei mawase the patient with a condition that the medical referral committee determines is terminal shall not be granted medical referral committee. Again, also kung mga terminal patient, iya committee di akal girel refer ra adal tuwa ba. Esel last tawa say other factors the medical referral committee deems appropriate. Mang aigel guk pebir ang aringi lomdas wa committee waseng maklaw tutelel aigiti al factor in rokuy emro ko may final decision waseng al patient kata ko ngel refer al moray krel belaw mal ubendiak esay gidal committee direct decide waseng raw hospital al borngi.
Sila Vice President al dumagugera taptog al patient al approval tir la medical referral committee girin momra li diakal volutur wak la temel umroli ma question mora agamiti Dr. Besararak na singanya timeline sel approval a patient girin mora a medical referral en civil murik la singgang momra oingrang nganya definitive date ngya civil sobre mangmom na temel umroli
kamal masar ramalungil gereng engarangi el angel tok tangarangel smera selmera madala medical referral en el present tragay sing bulolo ay sakmaset yang urgent semdo sing emergency within a week malubeng additional days yang manalang kalsmera urgent en si el momala weeks ma mo 2 weeks isel di regular en sa el momala apuil et yang mal di base ra at tele lang kalsme kamal masaw loger ti al question lang ngakatel agi tira klola bal atril pages rar adal el approve medical referral et ya kaloral for several reasons mal di personal either hindi ka enough hotel hindi ka adal sa elopa. So there are some reasons sme ra mo ti kaloral hindi ka adal al may emergency urgent la kalora we'll find ways to send that patient.
Sila Dr. Besara
Mama communicate why gigit emergency mo urgent healthcare fund will all communicate with us tralo si krolel yung malalas me el al time hindi kasme el mora huriping leng malmering la aral. Yakam sel may toktang el present rasme kamamal medical referral committee a recommend pasyol boring kalsme hindi so most rasme mura Taiwan leng telgibel pero aral compared to huriping unless yung emergency malubeng stretcher case isigi da kada masadra mura huriping.
Sula Dr. Besara ngani ako la Arekod malubeng ko la minutes la medical referral committee el sebe de lo mese me dañet na setela al patient approval tir avec el temela meeting le urense comitra every week ngani meeting ngani record agi del meeting remi el sebe del mes
mal nga record every Monday agi meet nga record nga talisit pasitwat al toktang amle present okore telal smer clear smer maramle approve yakto ay sarkawa mostra smer ati mo approve hindi ka katal smer ati mo approve unless yung mal obvious 95% of the time smer ati marahan.
Committee criteria blood pension Vice President.
Yes. So, ela kakoram lo mention na igel sel ludo draw eral kiki na healthcare fund. Sir semle annual 2,000 mo 3,000 3,000 4,000 mo half a million a year. Yars me ramle makasay. Sige del time o moral hartatag o moral you're talking about like 15,000 20 kagire malpera more than half of that Kamusta ka na 11 to 15,000 ko payment. Seraw eral gig ina healthcare fund. Maulam na makasas may early ability to pay. Adim lakal nga rarokul other belang. Kuk tirigal kuk nesa bariral come up with that money amaral. Di seral gig intel healthcare fund. Yang tiadim lo rayang atar smel maral. Esa ay said hindi akatal smel giblamem kim kotowar ngi. Unless yung mal ngay gigidal obvious reasons. Sel ability to pay lang amla model problem or other bela based on again four criteria based on family income 1,000 2,500 500 5,000 4,000 saya maximum el per niya na mo ka sa social ability to pay amla mo dekal issue ra mostrar mang again ng kamran masawra kari menting ngaringa gel baby ra issues el sme aramaral amal ko ra adak mo agi diri ka mangile dia mag tambe mal ko ka magibo mo agibom inquire ita siya toktang yang katitakal enser o yaki ko diak patigra adalo baka direct kal monsters me el model kaloray la agel ko ra orthopedic cases el chronic low back pain. Let's say they are fully funded by healthcare fund. They are cover 80%. Tadi mo mas ka 5,000 ya ka pay kasi ngora chronic mong sige kita direct tara issue mong gira dal mal mo ko ra ko ring ila gidal mil nga duro kasi lang ko ra mal mli. Sa mal mo kata du help kal mo sel baby lek nginong kanang mas arungo dia poto kera kata di me tangar leng tiakal ang kuk ngot al tokal ko adara healthcare fund sing diro si ka family escort mang direct kalmal taraya issue
Sulang Dr. Bisram Sulang Vice President ng Kadim Leswadel umutin na mandate na sing naringangil communication lo bengela healthcare fund mandado ko ramo katalakle the point a finger in mora ang elector kami kumsulang en lagi rede chairman quartel or detail hospital authority lo spare ngile Claudio Dr. Abdul Bela
lo isulo
adi kamlo geray gel ko ra ngarang clear minutes ngarang clear tirgal adra committee Aige chairman aige da boralla aige magulla confidential hindi ako sila disclose aige mang
o hindi Isabel to da di gel report di number tally hindi ako sila nga identifying ng registrala ang ulite Ministerio do Olmol Melmorsel aigel selastal sekal havra apro gagidele agenda git Mensahal mo, bibigay kita 3 legislation na mali focus sa vulnerable population. Ya ulmang aktilo sa ito bibigay dire ka nga requirement tra yel reporting dire ka reporting ilgim ngay magide ko lang araw blue. Makabe domo ursel RPPL 10-31 sa National Aging Policy Malsum suele director madrasa mkola dimo smodil wa ser girel ger girel ger sel written and national policy on care of aging nagirel more of sa president ma olvira lula 1 year after the act ya ongerung ngarige obsodel sel aging center Nagirel nga rin ako ra one-stop shop, nagirel aging. Mansum sabel, mkora sila gigid, dolmol. So lang director.
Ali? Gusto lang Senator Cuarte nga rin kapir sila national policy and aging ilgim ngilul may so I believe in we distribute it Oy. Sige el policy na national aging Milgot Mokler sira 2023 and signed by the current president the Surangkal Whips Jr. I believe it was September of 2023. Hindi sige del 2023 yung Milgot Mokler. Sel tenda story 1 ngaring igilway al for al requirements under sige del la. Yawan the first one na wasangiril mo rin designation and open office to oversee national aging care. SLY number 2 tegi del Masauder tial national policy on care for aging. Of course third one na Masauder wasing ngiril nga rin review ma-report national policy. And then number 4 Ambassador say the construction of social service and care for the aging. Oh, I believe that sila ako ambassador ako facility. So halidik provide ako updates the for requirements stated under the law. So sila was creation of an office to oversee a national aging care. Say already ngaringi formerly it was the division of aging under MCCA and then Seral Transitional Ministry of Health ang mloring isagidal aging program ang under division of human service which is now through EO 496 ang Viable Bureau of Human Services. Within that the Bureau of Human Services ang ngaring isagidal division of aging al mo oversee tagidal ay gidrokuyal al talenting ilaw girala aging care for Palau. So say already nga rin al office again ng sa igital Drusel EO 496 ang yam loob katakal waseng nga raayong sa igital Bureau of Human Services. Sa longerong al Masadra Coordinating Committee for Care of Aging was created al Drusel igital la and the committee have been meeting on a quarterly basis. But in addition to the committee of care of aging, ang Ngaringisel Council of Aging, which is made up of 16 representatives across Rabe Lawe. So it's Balua tuwabatal kabenor appoint adara abalu almorsegi del Council of Aging almi ako komte arsel balura tokora aging my elderlies. So essentially while nga rin atul el grupe nga rin segi del coordinating committee milkat moklog tiala al oversee tokora tial policy. But even before coordinating care alboringi before alboringi tiala and already nga rin segi del Council of Aging made up of rep from each of the 16 states who meet regularly. So already on a quarterly basis, the coordinating committee meet. Palau National Policy on Care of on care for the aging itil agi del Belarusi Assembly signed nga President sa April 27 2023. Ang mlegirel the next step after Almagatmokla policy arulia implementation plan. However, after 2023 wayablo laka funding WHO tirigay yamle step in ol nga sera kamamal fund provide technical support to retail policy on aging. After that yung mlaway lakaw daw the el malbol malkuk move on to the next activity which was the implementation plan. The al timing mlamering out though the WHO almutal will come in a contractor a technical personnel to work with the program release the implementation plan loltira cresel policy almlamumrek selguk toera construction for social services al timing I'm sure akong larming sa isel transition facility laringa of course in delaying we have budget issues shortage ra at low Ding el alta nga rin yar 13 el caregivers el give live identifier tiril el several mo or router say el transition facility. So we're just going through the process ra tele lava bilngir ma el may on board, but those there are actually 14 ng 13 el caregivers sa mawan el wal koramoners supervisor tir direct nga rin yel agomeng actual provide some updates ra activities ongoing girela ato ko ra aging. So of course take it liga transition apart ra say it like el real girela aging, and then nga rin sell home meal program girela maod la nga ra al sela balur ore so se malamol nga rin tirigel homebound clients everyday ruahera obisra hera mra mol mo deliver kalid raplirir ingaring tirigel guk bawo del dirga mobile matamera all the eight ra everyday for lunches. At the same time, ang laring isel agimle trial expand ring il morababal daw mayol daw. So early January mo June Ministry of Education am lesab el guk me on board all nga seur ka mamal guk provide ay meals el more tirigel elderly sector ospe meals ra babal daw mayol daw. However, ang lo stobra tune of this year because of funding issue. Direct one ra ruling division of aging make sure was setrigal elderlies mar adal nga rin disability tier low transportation services may access sa medical care ra hospital also kumanda ka transportation tier, and then it program make arrangement yung mga ititiri ra bliri may mestri ra artoktang tier, and then el mutel book mo ititiri more may shall I pause for questions or move on to the cell group next cell?
Hindi, halid mo ako tesel, ako may sel agenda yung RPPL number 10-31 niya 10-51.
Yeah, note nga ka 1051 ya kung missing.
I see.
1031 so.
Di sel na para sa ako te kapasural Sirtel National Aging Policy. Ya kung da siya mo spell out ay yel requirement more sel implementation plan. Le implementation plan na domestic di algilel institutionalized within the Ministry of Health. Maybe always a Ministry of Health. Detail program has to be decentralized. That's why ang cell transition home. Gilel include maybe rato empower our elders. Mang mo sabihin access services like anybody else. A purpose of cell office is to be one-stop shop. Malsumagilil aplalay ang license tir malubeng lirir malubeng rangklen. They don't go anywhere. Tadi maran mo sa yidel or cell office has decentralized more a state office. Emrula yigid role requirement to gira elderly kira gilbelu. That was the purpose. Mahumda si cell labora implementation plan Director Maraisaw. And gira spell out yung sa yel benefit lola other elderly secure or your agilil other kirang iwala sa may without having to travel or merula gil babilingir malsu mangaring yakar del gil merun malu mangaring yakar del gil merun en malsu mangirela tel tegit al adel sorry lo spera Ministry of Education kitchen en giril modong okle negotiate garogul for the long term mang ako na sa tel plan na del centralizing Bayil implementation plan na decentralizing. Make sure yang idil elderly kirak munggir rablur belaw ang may OCC services diway tigil kira madalai or even more ling. El time misalbol apla while license may gali disability parking mga raklel at individually termort. They shouldn't be doing that. Purpose ito kasi di lang na imolbasyo ilba state office tir or office tir ngayon ngari other mula gilba bil giri. Malamang provide a service sa mga open na wala lang mo ang i-request. Sa mga Senator Pedro.
Sulang Chairman. Malungil litasil sa Minister Omar Adam Toktang Tigal Directors. Kora digari kawase sel mo southern ilwasen transitional yes se sel lun mo kadong ilwase step down adang guk tadi eklutulo gelwase tigel Real other mo spare say the transitional facility. Are they gonna be? It's a private. They got the pera other yang private talon bali al ubet yang hindi mo free el partra hospital. Can you explain more on that? Sulang.
Sulang is Senator Raungil Ger. So to answer your first question, oing transition facility, sel waya lul makotong ringira before wasing step down. It's a transition facility operated by Ministry of Health under Division of Human Service. So it is a government facility. Al timing waya governmental shoulder a cost ringi until we find other ways wasing makarangabol sa betel tap into other ways of funding a facility. And I say that because I get baby models gibla mo mesra other region tidak kalbeluram rigel, and there's a system in place where ang sabi like benefits or tiragidal other support costra tiril kiray gayidal basyo. Hindi all time our system is not set up that way. For the time being, government will shoulder the cost.
Medic Laigel Blandong Director Madraisaw se Senator Pedro agi mu-open ringi hindi ko ram level daso aset yang di akal sa pedal di open ringi marada di directly lang arabalul may leng malmo ay alwid I can tell bit kadam sa
ngaringi right now ang sell the opening sa pedal accommodate ra 10
oy so say agi waram elaw waset ya open ringi mo arabalu kadam magegi so gim waram la ada du ringi wasay tirgel tiria mera hospital yang araw guru le margoy mo mrege emlamo dia kapasyon laborngi tirgay gid ya maasabi ng ngara sigid emrogoy sois para al seltia gid al facility matangaringi aktibo ay tra ya kegeder al wala president makam sure kami adro albira lulaw al open so sera sorara last April ya president tamle announce ringil wasing girel mo open ra sigid al ngara June di difficulty mamamle osir agimle announce ringil more other belawal wasebe yosper other belawal me urior senator talam sandia kar other belawal sorin me urior tial facility so agi tiagi dal kaltartela time agi ma end up was okay marko tungu tial osir other ngod al belul me so isba emre dal trula ba bilingire tat mok mel sis me urior tiang bol settle open ringi so that's what we've done recently maldo mo asabi il process sa bilingire mo open tial basyo tukora funding ringi se direct issue ng ma'am leng yang gamil senator sa direct tial tukora funding direct wala ka audaw del tuwa para ulbira lulaw girel tial facility mangkatangal-tangat leng director Madraisam lamo sa elsme kuk federal grant may supporter tiyang so we can open it hindi in the long run Emil senator sing gira dalo si a funding al may support at yung program rigida akong nasa ngungil program al morar ang ruspe angis we chairman so
I
lang.
see. Tilmo commercial original statement to sa step down malubeng facility care. Saya hospital. Makamsa dra public health dra aging. Ulmakno dilo sa part of the discussion. Mle budget de ka budget submitted. Amle ulag ding ilulo lera yang bots elobangela unified budget. Le gukka uduswela awda sa say sumaria investment rigid el bodol to embarar wata. Kasi mal nga ul mga tegidel council tegidel sel committee angar elit tegid amodong ok emergo recommend el mera ministra health was in order tegida implementation plan ako step so ambrulia study itel study mo include ang one stop shop plus ang temporary home ang rangklel mal sumar ada huktim lo let's say ng other lubadalale dingil tang uspera holiday ngul mortegi del home for 1 or 2 days recoup luton mong wadalam madam alwen damam makulgoni ase seguidel aulmlo gora makdulo se de discuss el tiap ne budget de budget el mortegi del aging girel ngaria girel parta unified budget ngidro we girel olngi tial baradel tirka their hours manggolam na expectation ng luwasing ngayaw na sa parang luwasing dimla kutya dimla gimu makoram da sa sitialel blal mo ito makulito si ngire del integrated tang minister mo part of the regular budget cycle. It is a very important issue. Ako kasi sige daw ulmak na ulit.
Senator, if I may, mlar al sila budget el black submitter ni. Now, between myself to you along the way, I don't know. Ding large cell budget el black submit.
Hindi akmal understand. I'm not making any akmal understand. I'm making a statement, an open statement. Was if they are important to us, kaya mo invest daw doon ng marwata. That's a statement. Hindi ako sa necessary direct lang the process. Yung minister mo. Langginel nga rin advocacy. The advocacy should come from those community members. Tige giril fight lo sa giril nga rin resources el todo el merta. It needs to be vocal about it. Magyadal enhance voice it. So,
Chairman, I totally agree with you. Akti, so akal din mo talmor tayo del facility agi wase ka hindi kami since ka na ma-start rin ya koram le taraw das wala mama wase hindi kami tungod sa olbira kalulaw madirek help palgirel legay tirgam suka ngarinya benefits sa lolay ngarinya bebira benefits sa lolay tirgal ade la mo care tial facility kalel sabi ed ruli amen ralla floor leader wase ay gigit el benefits sa bol sabi ed lola bal kuk support ti agit sel ngara al sel tial facility magkuklakad bodo si kapi saludo del monggerel me wise malupa direk taragib lam wara omdas uringi se dong dura adra HCFL expand ra coverage tiril mo cover tirgay gidal adal el guk mouse per tial facility may gay ora di wise
yeah, so lang sa tawag recommendation na di Dr. Besarak kora alabro to mo adala kal de alsmer ng matungin na dalawang la medical world surgical world ng ngari ako vidral sel just gukti ka mga maktulila ko but anyway say another subject kamusta lang Director Maday Salgirel tanya kami po sa next medalos issue RPP 11-36 girel people with disability tabledo ra ikang lolingit 150,000 la van el literal hindi tiyan rogir el process aquara dimlag aquara de kangaran gimra sil girel ma ulingit lo sa kami o sisul discussion girel gera coordinating committee ang ari 1% do the NCD ege 2 years temel emla mombre ka lebla mombre ka 1 year mendik medung girel gera ikaludo ma implementation ring ma-obis ang argir.
So, sulang Senator, again, as you said, ang mokmed el diwait al la al guk mil saudara 18. So halidik provide a really brief update before poktat cycle 1% ma 2%. So stay del RPPL 1136 directly mlewan na requirement ringi asang ginel mo ringi establish the Office of Persons with Disability. So again, ang mlaringi a division of disability, and then of course ang moringi EO 496 mangle create the Office of Persons with Disability under Division of Human Services or Bureau of Human Services. A coordinating committee ang aringi, so just like the aging committee, ang meet on a quarterly basis. And then self-status ra national policy on persons with disability, mlatwo the draft. So it's being reviewed by the coordinating committee. Apparently, sorry hindi mla ko ba kapilme, lenso kabal reviewing committee first, lotwa input ringi, and then kimotri akura draft. This say el policy, of course, and it was supported by CDC, marwa SPC, PIF. We asked them for support to fund a consultant will create a policy. So there is an existing policy, hindi ka draft ng mala committee members. Take the Office of Persons with Disability created through EO 496 and formerly Division of Disability. Tiang Aureoral support individuals with disability by providing services real time, include transportation, meals, case management, case referral, and coordination of activities with other NGO, and also it's the office other may access our resources different type of services. Sel 1% allocation mo support ra committee say away los peringi committee fund ra rural girela policy tel policy may at the same time implementation plan na girel mo ogiwa mo after sel the final tel policy, and then you move forward and more implementation plan. So in the last committee meeting, our committee recommend saying that we use some of that 1% fund local person metbu be part of the review committee al policy disability to make sure is local context embedded in the policy. So abebi raw daw there's a 1% aslat the local consultant. Sell 2% allocation support of all office disability, strengthen the services gulsadra before, and at the same time makamiri selgimit yakamiri dilulwase abebi resegi 2% direct girel mo o support makasang PPE. Makasang is the only NGO disability alselabelaw. PPE Palau Parents Empower Akuksel organization ng parents ngaringa algirel ngaringa disability. So that tool NGO disability ngarbelaw. So a committee lewasing ang kadamo direct allocate baby resegi 2% mo support activities ra kasang PPE. Ay galudo da nga alsela government, so Ministry of Finance. So previous discussions sa kamam lampungela kasang PPE awasing ay gagida requirement ra tigidala luwasing there's about 3 or 4 requirements luwasing ay teludo dangarang amols PL, and this is the process sel the access sa do dra government girel ngaringi ako ra work planner tir makura timeline, deliverable activities. So It's not just, asking financial wasem mla siya check al mura PPE for 25,000. There's a process that we have to go through. So mle adadu nga kamar adra financial waseng what would be the best way and the most easiest way el sabi el mabibiray ka ludo del mistri ay del tool NCO mel sabi il kuk direct el support ay lurior niya align with the requirements sertiala. So there's a couple of options that we went over kamar adra finance. So about 2 weeks ago ay ililutil meet and then nagulo ay cycle different options on how to access those funds. So actiming waseng when they're supposed to meet the other border and come up with their plan waseng ngara needs ma for our planner because I would need that information in order to assist them access cycle funds. So say ya wayal gora umso della say del 11-36 el girela yegi de ludo el 1% amos support ra kami tira el girela policy and then is el 2% amos support the activities ma programs ra Office of Disability at the same time amos support the yegi del 2 NGO. I have some numbers el mesada Tora disability stipend, but if there's any questions, I'll get 1136 saying extoben din answer.
Maya mura question ramin mura. Yeah. In club gula sel Volmersel policy. El gimre del wa kapiringi mal so del gain sul lo mesri. Again, I got a trill initiative girl a vulnerable population. Girl mo wide spread of the sweat. There will be a day give the well amal mo enjoy this tatrika either gainfully employed because of this policy. Makmusigi del morse medborselong day en mlamo fodori. Del RPPL 11-17 ako kilala psychosocial autopsy. Mang kulingita Everlyn sabel el oras modi el more sergio del morning solo
Mansulang chair RPPL 11-17 na sili to likin se psychosocial autopsy law se kuka sel officer kama pe oligering il PAL psychosocial autopsy law mo wala rule thriller adal mo kloran risel to south ringi. So as you may recall, imamade tiamlo amender cell 34 PNC, masele chapter 5 title 34 public health, safety and welfare. Et yang amlo dolmi sel dolgering ilwase psychosocial autopsy forensic review. Komal masaula ay gim lo masu bem lo metigal wase abela wa tarapulura blulat especially in the Pacific el meruler tiang makobran masar tal framework leteya momos misi arera. So as you may recall tamno effective sera January 26, 2022 sera leme yang wayal blol CCEC the legal framework of public health most of the law messes a certain circumstances around the self-harm, magel intent, edirakro omesagel risk factors that lead to such events. Dirakra tara partringil gimal korasa Maria ringi aseli 571 sel section 571 al masadra prevention segi doloria prevention na dirakra tara gim korahmal mlo oyang rakamil girel aseli require asel culturally appropriate and evidence-based approach o imang segi dral ko talto that yang of course a division na kikakaral division magikuramlo o mesra org chart o kimera ro ulbase poliliakal unit mesra poliliak o mesa segi dal org chart ramamel mloringi sel dolgering ilwase trauma and crisis unit تاجي اليونت oversee تاجي implementation and review. At time, I'm really honored and proud to introduce Lucy Gotaro, ang kaya program manager at the unit. Ang mo maskid update ra priority kita.
Ms. Lucian Gotaro.
Militasil sa kuman sulang at alan mo sa amaman me kuko ay sa Bebiraw nam katmokal malut katay gidel RPPL 11-17 mangway galadilong Chief Everlyn sira makatmoklat yalala lo malut mong gira man amsuber taltakoy magiulo mo ulal maaliya kora agigaren relationship loban gala American Association of Suicidality الممسوبة تاع science را suicide mangultulo tagi da dalwil lagi da ma AAS ang lo sab el train certified at el staff rabi 8 el tagi da toira psychological autopsy direct logi tagi da AAS matal dalwil lagi da bantari ang lo sab amam el ngusel form lo speringi el motmok tagi da lurior direct lo bangela gagi da training nglo ngat elam النوع هذا المهم train را staff لقينا la motivational interview recognizing and responding to self-harm risk etal training actually amni off-island training safe talk self-harm death investigation living works applied self-harm intervention وسيسيلتا من direct للملغة مقلا online data collection tool القرى دي نصو مام المس أمام الترا أيقال البيك بدنجلا أيقال suicide al salabalubela or death by suicide yulo mo ulal 2020 ngul mira 2023 nagim go tolo mo ul el ang agim na expand el gu ko mo ura 2020 emerald badula gem ne gotel el cases ra suicide gidirek no ngate elam el mingi the adra a pacific المية مسات مقاسين جوك مران اللولك توبس الشوغان رجيد بك بدنيرا أدرا قال بلورا تاي هيو أسب إذا لو سبي مليسي لو مسب أكل رجيد رتغيرا أوليسي إلا فاميلي parents ما ديرك لو قبيلة جايجيد التلاتين ما بالغراد المندقة أولي التريا رجيد المورا جايجيد التغيرا سيل فارما مال أوين dead by suicide مثل نلغوت الميرا غان مي سيناتور تشيرمان إغدا قلت مقلية من نلغوت الغورة ريبورت لو مسا يجل dead by suicide را 2013 المو 2023 الآن تلقوا بلم قد مقلية ديولو مسا 2021 الآن 2025 malo ay say tagi de lomsub no me saigel death by suicide at 2021 and mer ang en tay nga 20 cases al sa mo kwasen confirmed mal ubeng the lil asira chart at mo kwasen death by asphyxiation by hanging ay gel bebil nga tool undetermined mandim nagim included yang malumol Michael Gora wayal blel finding tel gada belum sub ra 2021 mer el ang umlo matig may gagi de rogul guys ra death by suicide tadim le saal esel method lo speringi by hanging Michael Gora amle common correlates intergenerational trauma family history of self-harm lack of social support poverty low sense of belonging and connectedness, polysubstance use, unstable family dynamics, tor omrodon, adoption-related issues, or forced kingship. Mang kwadi so al highlight tak mukwa sa igay ko rati malut kra haligadal saan. Wayal kora baram na tel finding arigid. Akmalmol me tiang ada al katingel lo masub ngaringi omsu balagilt makliya Dr. Paloy na 1985 alo bangela a father hisel ma Dr. Rubenstein sen mo meser tel gora report tel giblam rusi medalo sisi wa finding arti tigang amil suba kuk 39 cases out of 63 o mesin der team te direct kalmlesal timna kalabail malubet ta divorce mle Catholic direct kalmle o masindra timing dead by hanging Matial self-harm abla lingering in more changing social and cultural norms. O masindal nga rami karel ad. Adira kaltar abla highlight ringi tel subela Dr. Paloy tel tokor omrod ma single parent household. Direk logi tel sube agi koram namtigal mukwase ngaringi agora klon ngal sangsam. Kung tiangal angal songo sindik dal amiltin mo o ngite recommendation mo takay nga sewa da sige a resident al forensic pathologist ang amal sabel el ngosugid el mongil el mesang etitri talo masub mang mo sabel el maran masab aklar gid helper gid ngoygid el morsel mo sabel el gutmok lawngil program ngil ngeso el tomer malubat maroba igay gidale kodale lo giwa suicide malubing self-harm. Direct sel el-gora o ngerong ulne challenge or limitation sel gura el mga dadu or tirgal family malubet gora adal madangal tri tirgal baby regid na mortel el blagaradal eng talgibel nga ngi ako rasib kreng or hesitation or tir el mga dadu or nga kay enser ma sel baby rata magyomo ulal o monday complain gora da gimsal morut iya hindi direk ko dakal sab el murile ak understand that mo tangara gora makita time tir makita rang rit tangara albu tangara tokora karyor mang require nga kalguk lumutan mong mandia kala makita di sel bol kumangat gungil at timing nga kamo gilel talgibel gora strategic. Let's just leave it there. Okay, so akmalmol mamaso yel kora atokora system ma omlisi ra aurior no se ada gutmok el al rak or until now sera tune dongot mok lagi den mo so is ra mini games ang no nga te level el mo partner lo bante ada WHO e launch ra Palau mental health promotion and self-harm prevention strategy. Etyang ako rakatingin strategy al digilt makli. Etyang adingilu kora shadow or sel WHO live life model. O direct lulgiw tiyang no sab edel implement rawan natalang tingil tel strategic plan gilt makliya o tilak langar campaign. Kama Manila springur kumiw mang kada agi mormos mang mo nga biliw mo kada mo kay nga sir tagi the campaign ruli mo nga ngilal exposure maklam dangin ang atara palu ta campaign ang lumuul plan sign na ringi president hotel one stop September o tilak lang tal la seran makatmok en kotal dim naka funding el meso isa ringi mang Hindi nga niya, abebira fundra obis, ma partner civil existent no sa mamal olingi tanges we egut moklay gagi de lorior mang selbodo message tagi de en last goramo partetel reporter mam gagi da gora recommendation agi direct close spera rehab agi acknowledge sa mo do spera rehab for all levels of polysubstance use disorder. Dagi direct kolomen sa kung agila dal mo adapt trakora ang rankle system, it medal white tele la foster care system, and mo address sa baby rigel adoption malubeng tokor omro dara balur belaw. Le pato ka negative side effect ngi also kung manda ka balungin makatmok. Agi direct lulma sa mukwanseng altang ngiya ungil do podosig or omes ratokoira life and death or memorial insurance mang sabel kora ko baka clear barete like alsang ma obligation er gidar alsang sel kora financial aspect ringi de direct ko wagel na madung regal baby report chairman also kung man nga kada acknowledge sa kung man nga ngiyanit ang agilan mo nga dedicated scholarship for more students malubet to ko adal المو رتاجي special tira behavioral health اسال مو من ولبون الضعف أقل الأسيرسك ما sustainability and expansion رتاجي psycho social autopsy mal para mlain so kung mong mong ngi at al mong ka baby ra funding and may misi itel program man musulang al nga nga gedang mura chibrang
Sulang. Ko pinaulala nga niya ako na yan mura kabang Senator Tablon.
Okay. Sorry, Chairman. Kutaro ko man sa report ragaw. Akman mo na sunod sige del kamlam alit toy. Era kalwi de sere sel YRBS amal makatatal do laigel surberan alged. It goes back. Di nga surberan alged ang ani trigel already temlata lomdas. Alu temlat mo kamang lomdas ra waisil toy. Makman mo na sunod sige del blam kot makli. Sigal do ule lebom dolisi irtial mo kadamor ser prevention asum ngaria usir nalge de ngaria mlat kroise ngara sebe gut mukril in place el system el mosebe rangal gal moisel lom godong malu betu reach out makunta sida kuma singil mon kotoram lisi ringi eto gubet selengak mor babal dabling roid de gal gedra amre del nges makora di ogiutiak men ngasul sak dumukay sul support taigil el do mo se el mora school ebo matatan mo ay school mo duran ko sing ngrase el ngalgal mo ay se en taase el kolongi mre del time sige da woni time sumi gamile kom lama lama isel mondi makatatal ngania survey e makatatal do ngey hindi ko tuwa di sel matamal lang alge de kita ko mokora mongol lo mangi ingimi te ko iti ko eren molmo ko tube ko kora mongol lo mangi Vice President Takman itang isara mo kora kut maglita gid program tirgal mo ko ay ko tungil program ra Ministry Health A+ sel to kora ala dental ding la school leta ka ko sel mo ra school ra bekel temel elak mo ding temora babel da sel war wang yaw temor overnight e gut mo klaung lir rangal ge temor adra blup gut mo klaung lir es el oral es el imol blue adim lam got mukla it's that kind of program those pairing in awing kagil to ko maktol ni tangin se da isu masuk ngani akora uspal mergamam emlo se ba bien mergamam gibo mo ngem lakadi dosa de ilagim fund el vira time ko mo sa de dia kada fund mo akwa de mo community support se segui program sula
kami masulang Rusyang before ng tukura rangal kabel ol kolarare beka ko sipa mang kadala ko o sigra adal maral ngal ka sa piral kolar ni atirikal segi dal omdulaseng adoption pattern and single parent household amaral ulkora associated with mental health self-harm risk. Mang kadwaya to kurang rasyo kang argidel kuk marak lang apart kura mlamo oita arangal gedra talong lele self-ebilel algukpol laka ngara arangal ke ngwal kwati mo itra talong alet ang kwati ngal gedro ko inding di kanggel mal adalongal katni itirge kital ngal kabel ol koramo makitaw da swir mang ngaring sel biller sel kinsip foster care system mo o domdas lo asik na makarangi itirgel adalangal kamo sa iral nguwe ol nga seoringi ma akmalol ni talwa sebol sa pela ay gahidal findings mo supporter tay gidal bill bol sa etal edalutal mot make da subil basi kad makarang rulil mal mo o wayal lo speras yugang argidal al mutal CCE family unit mal ubeng al sumangguk mla broken down na family unit yang marang community kita al tukuk address rarangal selbe bile tangaringa parents al maral mo kira ang parte ngal gira ako kirtialo tria grandparents and then ang grandparents mo smer and then ang well kurati kaya adra blidir mang malgidet al address sa igid isu makmal marenga suli wertel malungi lurior malolitra se boda taget lukto subi sa igid al bilo la sa kadam karang help oy and direkal akmil ngui ra imol arigal al girela awaya arangal kang nga group of friends el established ra itself school tira tokora trainer til wal pol sa pil identifier tigay kital high risk malubet tangal kal nga problem atit etta dirikal wayal kora actual wal friend the counselor dirikal at the same time and sa pil kol ra professional sa pelol nga siya tigay kital ngal blal to kora identifier til basi nga risk til but all friend tira ko talmom tangay mang we hope palbasing padatagit direct establish the programs the invest baby raw do that al hirarang get I think it will really help for our future it ma kuman masulang
sulang akti mumre nanti kaya teme de di mal understand ra sulang rusyangan mal gora miski daungil update retel program especially tegid el otutel tegid 11-17 tora psycho social autopsy akum dasing mal intentra la amal lakatak el suadal make sure kada mo understand complementary kita mas el mo understand ay gelwal ular adamo kamita suicide malubet mo malamal na dingir leng lela complemental no marak plus lela complemental girel identify gigid el science malubeng indications adamo malamal lertir tral lo siga program mga ngesul mo sab akra adam hindi kapol lo laklang lertir el malubel lo malamal dingir akmal understand kamal msaul el noso el highlight tegi del wal challenges akum da tegi del challenges agirel mera attention all bi daglulaw ikatray nga selo mesek na sa magarang overcome tegi del challenges ma limitations identify tiang sel gotal challenges of mention ngi tegi del limitation of forensic capacity gausel success tek na sel bongani ang tegi del kora patalatis del mo wal help etc o tutelaurior el gua seta abelaurior bodam duol tigel gukmo o real nga ngel gigida patalasis pol sa iril al consistently capture gigida data ma information those pel to make decisions madi gora di grigak nasing ania agora effort gigida el almla gora statal recruit gigida lang gigida patalasis nga was the likelihood of getting I'll hire a pathologist. What would be the cost associated with the hiring of pathologist? I know it's a specialized field that may perhaps it doesn't come cheap. Get mo understand mo o mesek na siguro mga na funder o pathologist mo part of that program. Sel to family reluctance akum naseng adirek al lungil gigi de petalasis pol ko head per gidel kora mabia approach gidel toward dealing with the families material adal tira aswadal mo ega direkal wal kora urere la med mo urere la police tirgal investigators rock crime en ngani gidel kung dasen kora ungil protocol ma procedures that we need to put in place hindi mo na mention hindi ko na mention yung last part recommendation say you talk about it I'm ako marak na sing maral one challenges ma limitation kami ato about it ma dito ring iterngin kami ak na symbol sa il الموقرة مونغيل مساجي جدا المين التشالنجز رميو مودارس لوجي وأقرا بلان ما لو بنجلا باتشيت ريكوست رميو الميرا والبيرا غلولام بلس بهذا المسج بلس هذا الادريسنج ديري قال دخل ميك سنس هذرو لا اللي قال بهذا الفند افورت المو implement ay gala mang so dal dire kal kora kay ng sales klaseng makarang mas edel al dokta ka effort sir gide bol sa edel guk address ay gide limitations sir gide sulak
Das ist nam o 5 o'clock. Kung mam sulang ako das is mga sulul gire la gige report. Ya di were miscellaneous malngari ako mal burning el tingin malben tingin memdong. Edi wala da yung minister hindi kaya tril to ako ta sel RPPL 5.3 require a cancer registry by law. Kung masinda ka effort el gire mang gira don mo messaging lo sing gira don mo o message ang yerung pala babi minister klesi le course August 28 25 gira la ay gaya le uric acid ma renal failure ablu belaw magulit dire kul at some point tra will but the others say ya last tra wala ka paska ma hindi la microphone na closure Western Community Health Center next week sing rumor ng maral to.
Alok ngulm sa tartiri kam tamam sa rosel to era cancer registry di to sa ere mauriule atilungil besule yes chairman ngaring isel lerer kaon lergi ma direkal gulingit mauriule direkal bol sa pedal bukti address ringi sel finally sel YC ngaring ya babier lara talent owner wal waramer kamam wase se gidal western Community Health Center lakal the peraw daw yung sabel ngaringi mo masimra yung mo masimra tamolo yagay trabasyo hindi el al time iso kalaway so sa tutaw ya AG rabulur belam lekantak teranga kalitiam lamora imala AG mang lekantak teranga mga adu way seranga kalwasengi ma kay the land owner ada adu. So I hope yung nga rin maungil resolution rin mandi ako tabor sa ikidal close down pasyo rin ako marang alwaseng most of LD maungil masul ako mesra time chairman kada tiya na 5 o'clock hindi mla rin tiya dekal partner tiyal meeting rin al sales hindi may walingit di kung 2 minutes kung sa nga director Arnis UG balgora kukti mo tertial ministry kamame el tiang akora girela yo sangar kamame kami ul senators makura ding umsang kay gidi akor urur tatako era a financial kamamra entire ministry mang atang
Oy director UG hindi bol blok taklo set ya alto ng esar kukti mo hapen le ko
Malungil litasil sa chairman marvakal senators and Minister ako mamamlak mo ndak kal partra agenda di ulmak ngarta nga gira kal me kmuigang aleng agim la start encounter a little bit of a problem so sel continuing budget el gim over el altam le include sel dimla kal include although del gira la 10% el salary increase e kama mawan rahmal klol ministry 430 some employees. So di kalbol even 2 weeks into the fiscal year yagim la projected o di mamra finance. So tiang ngaring implications ringi leng store ka mamalhair. So before the fiscal year ended September, we conducted several interviews at Toktang, Marnurs, and we've selected those to hire. Hindi kalsab initiate the employment contractor tier leng projected al ODA etc. ma'am. So we're asking hindi ko kasi continuing budget ng asapela was supplemental hindi also man sapele please lagi lucer tirgal giblam interview tier. And additionally nga rin tool bureaus under the Executive Order 496 al gira al magatmok gira mal appoint tool directors without their budget ang direct kalokora problematic. So just asking for some help per se konsulang.
Di ako man masaurital. Requester kami, Vice President. Katala, hindi ako nilo asay kita katala ako rang ako sa siul. Luldason di hindi ko maralo asay kal. Sel ba continuing resolution? Katala level ra sel previous years. Sel level sa igid malsugo mga nga ba sel program los pe aka pa sel daw. Ay girel al sumudo dirar. Girel oili sel budget al adoray sa igid daw. Sel meng musbedel perar adro sa igid lududir. Retroactor til mara day one. Sa igid ako pneo sa kartel continuing resolution di nga niya babil to dia a director budget. Paktir ko lumas sa tial agila del address ngileng. Sel do continuing resolution and di masawder sel mle budget tragara previous year. Mung aigel besel program besel do da ke sel top da sel arang lela budget. Igida mo sa edal tekre igida mang ang require retroactor adra day one and more sel time la. Makodi duli sa igida mo sa edal kay kasi orangin nasbil mo dura at milwa se morgaditang dorgaditang tiang ara madara tablol blare lang. El bol mre friends ang ultrok la di mo to tiang ala. Asenet omral asen dim nakalo to di mausum din nakalo to di mo kumasta di mamrael. Ding sige daw na cloud nga karagil duk continuing resolution na nga basel ang sel budget at tial mo namre karak. Ragil first 3 months. Mang ako dio sige daw kul meser nga mang adira kala sa pedal kayong se mo ko admilo sa el sung mga nagigidil ko expectations sa miro sa tial ludo da giril mo lang. E mo ngelo sa tiang nga ramadal olbil sel bol mere gelmeng sibil Michael Lududi, retroactal morsel day one ra talo lalarang. Kal duli segin makayang sel malgora adeng dire kalgora maringala adal du kasi nga girel mo ba udude kay lakal ba udude lang amra la girel ko nga nga ngil dul mortir.
May floor leader edik peliti agi. Agok druulela executive branch. Direct lang may legal advisor adralla. Direct lootil was saying tial salary increase ra government tamlo take effect ra October 1st. Diya ka sel ula continuing budget authority diya ka ra alsel abat sa losto per se gid salary increase lomo ra October 1st. Kom la direct lamsa nga babilengel a finance ra balur belaw latwo badal mora rukuil branch ra government rebelaw waseng mo implement sa igid salary increase ra October 1st tamang kamama part ra executive branch amang gira mal di follow ra atokoy la tuwa ra Ministry of Finance et yang of course a president travel urbelaw direct aware ngay nga ka kuk ka sel cloud nga ra atokoy ra la mang sel tal blam gat maklial la alwas yang mo effective a salary rar adro ing ral sales engirel mo ay say mang ndiak ngartial di bay tulo bang gamiw aktiswa kalguk ti o ti adro lela executive branch alwas ali ti agida directive mlatwo batal mera igal branch ra government rogoy alwas engirel mo ay say gid at ang tangat ringi gamiul senator sa waseng tial actual receiver salary increase al adyak low real mo next payday al uben self following payday why say legi daw dudel el agi daw dudel next week girela hours al beta put in ratel al weeks ago so say gidia makpi duli say gid di gagida kora budget officer ma'am finance officer kamamara ministry. Aldim lamas kami wasyasing alwaset yagi da given the directive al giblamu ingira man implement ringi mang already sel take into account the salary increase marukuil tokoy agim rengel was agim lamor already senator sa mga sa iya ko radyon mamal merang miwe kumsulang.
Di ako masauling tumral amralo di segi di ako ram ni understanding rakuk egal margol government kadam di la sel continuing di ngusel klungel abat se tergaora sen nombre garak yang ngarinya esel requirement raudo den girel ngarinya ande kat sel continuing lo to raudo girel segi de program engya ngar under conference ra gal tablo blay mong aldas to ase Lolomon mga sel cook level ra 2025. Edi mo ay sa trigal adal was it ya sel bolo roren como retak taw di ra they one more sel time bol or tel special budget. Segi da ko kadim na singe dringin di sugum ko ra karo sa singe dringin nagidel kay sel was it tel budget ra legor ko mira 3 months. Adi kadil bora salary rokir. Dire kala sa piul ko omes singil was segret sa pedal sumi ka kala sa pedal adjusta. Although masala re igel bebil ko kuls pedal ko cold ko mura ay gigi dia ko o meseleng na amral telibur ko problem tel ngaring hindi ay gigi dia amnel das esel ngari continuing resolution en gire di morsel level at term nombre gal budget makodit mo gigi de ereng isu mere dol mol mul ko o meselilo sa kadam gramot mo erengi ding natabdia de suela executive branch Digio, gugugio lumes ringil was tial agire del modileng ay gal na omre gal sel dot dia continuing resolution set tia di lol mol government malakal close government el logrol nga level at tian omre gal budget segi dia nil das mar sel bo logrol tial sel adorais gudo del mor sel asel program edo top dugo mos per retroact ay del ludo del morat se di por adios nga ringil was tiang alas el logrol del sum mal digang Kutla o sigang o rolel lang. Ding akmadelo asen ada kat sebel di dolmon mo continuing el bornya kanta bornya supplemental mang. Agi mlas mo re dara akan friends ending tegi da to mlamelo ase. To ko radir ko musuba igel ko kumne version ra senate el mo sel bol ready ki mo ado to kirel ko.
Senator, I think kasi change bolderly ra clol finance el mora payroll rogi so while da ka teelam almost tobringi or anything tum na change ra pay scale it's gonna happen and then tegi del bureau while OD tel Bureau of Hospital Services and it's by 522,000 na projected OD by the end of the quarter if hindi ka ngot al ngasul masoyis bra alsel. Hindi mo kama marumula FAA men even may gal kora assessel nga ra public health masessel nga ra BHSA adi kal enough will cover segi del shortfall ra BHS mang adire kal also as mamal dire kal modal sa amal do anything.
O dia kung may sebe, mo normal martil ay gire ni gumra la setyang ibin awo mo dim direkal adirekal disabil top daw do dira admi disel bolor at tel pesel budget segi de nya mo sebel tekkera ay gigi rogu ile ngani pandel gire la tel 10% tel increase
Mamawil Minister Mam Sulang kuma Michael Mescaw Mamdu ko statement ko ngani di da maswal mega comment ebo the close ra hiri den ko ramal namon
Maday Chairman Senator Cuarte kauma a floor leader mga miul senator sa Rokuy namrayal na president ra Senate namang akum ter kamami imre nga suli Rokuy akum da sa kadamla cover bebir ay gadiak Rokuy issue ra Ministry ra Health and Human Services kadukok tim la cover a claim el al sales itiagi dem la take up pak med ledel sigang ratte med agulingit lo sellu talguk moria tarate al eguk te meguk address ay gel bebir aguk area sertial ministry agum das tiagi dial atrakot el klol alwid ang lakot at flow ministry rakavalmen terbelaw malolingit malospe ang esor kamior senators kamamya amrulaw rio lo sigarolel en wungila augurul maheldra adra balur belaw ospe amaklo ngesor kamiu mang akngartialom ter mamroguy malmarang asuli urtial te alle malmol malolingit ta support kamiu ligila laurior tial ministry ligi mangarngi maktingol merit yaigid komal masulal beklaf
Hotel era dora le mga suligire legal t-shirt loros magimo kora advocat telgiriw ya minister mle purpose tial oversight adi layout sel overall vision الجدر الرغوية جديدة المرأة البدوري ماذا البلاريرا trust territory days المي أمنا مو outdated hindi kasi din malamol mal mga leo orase edom da so se taklop se generation ng maral may mo healthy mas stipul del dollar ni understand niya si yes ang mo niya gaps ra funding but we have to move on we have been there since the 60s adome sa gal baby rablo na move hindi del FAS ang osisyon madol kaya territories may garol bulu may galil bulu Fiji na move on marangot al madol we need to move on al sugum kad mo maleo ladil tial tel role ng mga domestic currently masel especially sel tel role we owe it to them to move the model makmena sulur al siamle ora purpose tiang spell out sel overall vision ng kita maraming budulnya magtakra at belal gila laheld ya next time katong mula ikil ko makay minsan din mo masada ikikit makmena suliw di mutual open na may kanya ako na final comment kami senators kung ma'am sulang tial hearing adi merita mo sulang